Good morning to you all. Can I please ask you to take your seats so we can start with our event? You can't hear it well? Like this? Yes. All right, I would like to welcome you all to our Schools for Health conference, making every school a health promoting school, from awareness raising to action. It's so nice to see so many of you here. And also a warm welcome to our online participants. And as a housekeeping note, we need to make sure we all use our microphones, otherwise our online participants will not be able to hear us. And another housekeeping note is, in any case, if there's a problem, there are exits at the back over there and where you came into the building. My name is Caroline Kossongs, and I'm the director of EuroHealthNet, which is a partnership for health equity and well-being. And we have been coordinating the Schools for Health project for the last 3 years. And the Schools for Health project is really a project close to the heart of EuroHealthNet for 3 reasons. The first reason is that health promoting schools is really health promotion at the core. It is making sure that children and young people, that they grow up in healthy environments and that we look after their physical health and mental health and their social health. And that is, I think, something that we all inspire. The second reason why it's important is that health promoting schools is really a way to work across sectors. We have a common goals between the health sector and the education sector, and it is really important to see how we can work better together, and also how can we pool budgets, for example, to invest in health promoting schools. And education is also a very important determinant of health. You may have seen a report that we have published in September. And in that reports on social inequalities in health, and we found that people with a lower socioeconomic status or with a more disadvantaged background, that they report poor health twice as more than people from higher socioeconomic groups or a bit more, better educated groups, let's say. So equity is really important issue that we can address with the health promoting school framework. And that's then also the third reason why health promoting schools is really important for EuroHealthNet, because it is a way forward to address health inequalities. With the health promoting school, we can apply the proportionate universalism. We can target those children and those schools in the way that suits best the needs that there are. And equity is important also because we know that there are big differences in health literacy between children from different socioeconomic groups, and also between schools. There are differences in the way where they're located and the inequalities that we need to address. So that's why it is a really important project, and that's why I think it's so important that we are here together to discuss, because we know that it is easy to say what we want to do. We know what we want to do. We have all of the methods and the guidelines and so on, but it's also important to see how we can be more active in our advocacy, because both the health sector as the education sector may not yet prioritize health promoting schools so much. So our advocacy is important, also because we know that within the sectors there are difficulties in terms of shortages of staff or time constraints or other difficulties that the sectors are having in dealing with the day-to-day challenges of today's lives. So we have quite some challenges ahead for us, but super nice and super important that we're all here to discuss the health promoting schools together and to exchange as much as we can. And I'm really happy to introduce Ingrid Stegeman. We have a fantastic EuroHealthNet team, Ingrid, Gabriela, Emmy, and David and Chris. And Ingrid, I would like to give the floor to you to introduce further Schools for Health. So, I think this conference uh, marks the end of Schools to Health project. Beyond that, and to see how we can continue to work together to bring together education and health, and to integrate health in schools. And the health promoting school approach is really about bringing, as I said, bringing together integrating the health into the very fabric of schools. And it's not just about adding schools onto health onto schools. We'll hear more about this later today, but the health promoting school approach started about 40 years ago. And the movement has slowed a bit in recent years, in part due to the COVID-19 pandemic and the events that followed. So our aim is really to revive it and to strengthen the momentum of this movement again. Because when schools cultivate well-being, they support things like concentration, motivation, and performance. So I invite you to imagine a school where every child and every young person feels supported, and where there is adequate physical activity, healthy school meals, and the daily school life involves kindness and inclusions. And mental health is valued, and every student, regardless of their background, has a fair chance to thrive. That is the vision that we are here to act on today. So, because the research shows that when students feel better, they do better. And a good example of this comes from, for example, the Healthy Primary School program that's being piloted in the south of the Netherlands. And in this program, introduced 1 hour of physical activity every day, as well as a free healthy school meal. And the results of our evaluation were that that math scores improved for all students, and body mass index, for example, dropped. But there were many other additional benefits that were found. For example, there were less conflicts, less bullying. Overall well-being improved in the school. And there were also less inequalities in the schools since all students benefited. And in addition, in one of the cities that was studied, there were 25% fewer contacts. Youth had 25% fewer contacts with healthcare services. So these impacts extend well beyond the classroom. One often cited review, for example, has found that for every euro invested in public health in programs like these, it brings back about 14 euros. And this doesn't even take into account the potential savings to healthcare costs. So why aren't such programs being implemented everywhere? Particularly since we know that basic academic performance everywhere across Europe is declining, and that mental health amongst young people is deteriorating, that teacher well-being remains well below the average of other professions, and stress and burnout in the teaching profession remain high, even though there have been some improvements since the COVID-19 pandemic. But the declines in academic outcomes means that schools are under enormous pressure to do better, and not in terms of health and well-being, of course. And as a result, initiatives that promote health are seen as a distraction from core subjects, such as math and reading, and not as a solution to improve these. And in many countries, education budgets are being cut, and these kinds of initiatives are the first to go. So the same situation can be seen as happening at the EU level, where health, social, education programs are competing with a lot of other priorities, and also risk losing out. But we know, however, that education systems are of foundational importance, and health is of foundational importance
to achieve all of the other EU's current top priorities, like competitiveness, security, preparedness, and skills. So, but again, this isn't about really adding health topics into the school curriculum. It's really about encouraging students and teachers and the school community to, in an ongoing process of reflecting on what aspects of school life need improving, and what kind of and identifying what kind of initiatives are needed to address their concerns, and in engaging them in implementing and assessing these kind of initiatives. Because when students grow up in schools that model participation, well-being, and respect, they carry these values with them into society. So throughout the course of today, we'll be hearing about what kind of tools, programs, strategies are there at the international, national, and local level that can help turn the vision of making every school a health-promoting school into action. And first, we'll hear from international organizations like the World Health Organization, where this concept of health-promoting schools originated. And then we'll also be hearing from representatives of the European Commission about what kind of instruments they have to support action. And then we'll hear from public officials, experts, school principals, staff, many of whom have considerable experience already in integrating health in schools, and some of whom have only recently begun on this journey. So they'll share with us their experiences, their lessons learned, and what they feel is needed to support every school on this journey. So I hope that today we will inspire each other, learn from each other, connect better, and leave here with an even greater commitment and determination to act and to make every school a health-promoting school as a key approach to a better future. Thank you. So to move us into the first session of today on the policy landscape, I'd like to introduce Goof Buys. Goof is the manager of the UNESCO chair of a global chair of health and education, which he set up in 2018, or was co-set up along with Didier Jourdain, co-founder of, as well as the WHO Collaborating Center for Research in Health and Education. And he's really an expert in the field of schools for health. And between 2007 and 2014, Goof, you were the manager of the Schools for Health, the SHE network. And you've also been a valued member of a partner in Schools for Health and a member of our advisory board, where you provided training on the health promoting school approach. So thank you for being part of the project.
Thank you. Thank you, Ingrid, and thank you for having me here as moderator of the first session, where we will explore, as it's called, the policy landscape. And we have great number of speakers, most of them here in person, some online. And yesterday we had a pre-conference actually with quite a few of maybe who were here yesterday. Can you raise your hand? So that's a lot of people. That's amazing, because we had a really great pre-conference where with all the partners involved in the Schools for Health project really reflected on where we are with the project, what happened, engaged. It was a very, very interesting event, and it's set the scene, I think, for today and also for tomorrow, because we have another event tomorrow. And it fits very well with the great introductions words by EuroHealthNet, Caroline and Ingrid. So I don't have to add anything on that. Apart from one thing, we are in Scotland House. Well, apart from my personal relationship, I have a Scottish partner. My kids are half Scottish, half Dutch. There's also something very particular I wanted to mention, because Scotland is one of the examples globally where health and education are truly part of the education system. I think it's a really great example. And it actually came out because I know a little bit about the background of how this became what is now called the Curriculum for Excellence, which was introduced in Scotland quite a few years ago. And that was part of actually an ongoing government commitment to fight inequity in societies. That's been going on ever since Scotland became independent in 2001. So the Curriculum for Excellence is a part of that change. Automatically, if you want to fight inequity, you have to do something with education. And the Curriculum for Excellence is interesting in many ways. But one thing I want to highlight is in the concept of Curriculum for Excellence, which is about, they call it, place learners at the heart of education. So I think that's, if you read it, it's all very, very inspiring text. They have an ongoing curriculum from the age 3 till the age of 18. And they have 8 curriculum areas, but 3 are central. 1 is literacy, 2 is numeracy, and the 3rd one is health and well-being, which is a completely different approach to education. And it's quite different from what you make the distinction between add in, add on. This is a different approach altogether. And I think this sets, the scene for an inspiration for all of us here to rethink education, because that's basically, and hopefully we'll also address this in the policy landscape session we'll have now. So I just wanted to say that. And now, without further ado, I'm happy to introduce the first 2 speakers. The idea was, but we will not do that all the speakers are seated here. We do that at the end. Hopefully we have some time for some discussion, and please put your minds on what the people are going to say, so we have some good interaction afterwards. So I'm happy to introduce my dear friends and colleagues from the World Health Organization, European section, Sophie Julien, who is Technical Officer for Child and Adolescent Health, and also Martin Weber, who is an expert on child and adolescent health. And you will do a joint presentation. You sit or stand, whatever you want. I don't know about the camera. So David, what's the best place? Yes. Oh. You can stand there also if you want. Yeah. Floor is yours.
Fantastic. Good morning, everyone. So I'm very happy to be here because I think it's wonderful to see how many people and different organizations are here for the same cause. A big thank you to Your Health Net for organizing this event and for having us here. So my name is Sophie Julien. As it was just mentioned, I'm the technical officer for child and adolescent health in the region. And so today we'll speak about health promoting school in the context of the new strategy. And indeed, I want to start by sharing great news with all of you. And actually, at least 4 of you in the room has been co-writer, co-developer of this strategy, and many others also directly, indirectly, by the participation, engagement of non-state actors, engagement of adolescents. So this has been a long journey and a lot of people working on that. So this new strategy, A Healthy Start for a Healthy Life, is the joint WHO-UNICEF strategy, marking the roadmap for the next 5 years. And it's been recently adopted so 3 weeks ago at the Regional Committee in October, and it was unanimously adopted by all 53 member states. So I think we have reason to celebrate, and it marks a very good starting point to continue and to kick off the health promoting school. We heard about revitalizing, so I think it's a very good opportunity that we have here. So before unpacking a little bit of what is in the content of the strategy, I want to provide you with a few updates and providing you some knowledge on the material that we have been developing over the last year. So we have a series of fact sheets that were developed on 15 challenges for child and adolescent health that have been marking the priorities for the strategy, but that are also very good resources now that we're working on the implementation. So you have different topics from breastfeeding, mental health, digital health with the digital harms, but also access to care for adolescents. So you can access them from the QR code, and I'm happy to share them. Then we have a series of reviews. So 7 of these topics from the fact sheets were further developed in collaboration with our collaborating centers and also with UNICEF. And so there's 2 topics that might be particularly interesting for you. There's the impact of the school closure for the school-age children with early childhood development. So from early childhood development, and the impact also on the grading and the scoring of children in math and different outcomes. So you may want to have a look. And then we have 2 publications that you may also want to have a look. The first one is we made a survey exactly 1 year ago that we asked our member states, as well as child health professionals and as well as adolescents, to understand, to mark the priority of the current challenges in the region. And so we had the priorities to understand what are the remaining challenges, but also to understand what are the emerging challenges, so that the strategy could very well embrace all the current challenges that we have in the region by understanding these 3 groups. No? So the member states, the child health professional, as well as the voice of the adolescents. So the findings are on this first article, and the last article here summarize all what I'm not able to tell you in 8-minute presentation on what was involved in the development of the strategy for your information. And the last piece I want to introduce you is the country profiles that we have developed and that were published on the day of the regional committee 3 weeks ago. So 53 country profiles, 1 for each of the member states of our region, and a regional profile to see where we are currently for all these challenges. So we have 1 indicator as a proxy for these health challenges, such as I say, breastfeeding, nutrition, mental health, early childhood development, immunization, etc. But we also have a section on policies for child and adolescent health and the system performance, including 1 indicators on school health services on-site or through linkages. So these might be of your interest. You may want to look at your country and to reflect on how to move the agenda forward. So Sam, you can access them here. So the strategy, very briefly, and then I will zoom in 1 section. The strategy has the vision that all children and adolescents realize their right to physical, mental, and social health and well-being, and to address all these key challenges that were identified. It's structured in 5 priority areas for actions that you can see in this slide. So the first one is about investing in early years for long-term benefits, including investing in education and health promoting schools. The second one, we have it here on the bottom, it's about providing accessible, equitable, high quality care to every child and adolescent. The third one is about protecting, disease regulating, all the policies that are needed so that we can ensure that our children and adolescents grow up and thrive in a world that doesn't make harm to them, about the marketing, about the unhealthy foods, alcohol, tobacco, etc. So that also obviously involves this area and these policies that involve the school environment and around the areas of schools. We have the multi-sectoral engagement, and by the picture that you can see here, you can understand the role of education and school in disparity. So to improve health and well-being, obviously, we need to go far beyond health. This means education, social, transportation, urbanism, etc. So this is really what it is about. And the last one, but not least, is about monitoring. So I will go very briefly to give you a bit more insight of the multi-sectorial engagement. So in this document of the strategy, we have a couple of, so we have 2 different sections for actions. The actions suggested by member states and the actions on support for 2 member states by WHO and UNICEF. But altogether, it is about fostering a multisectoral approach for comprehensive challenge and health and policies. So as I said, going far beyond education, far beyond health, including education. And so to what really matters to us in this room today, so it's about creating empowering policies and mechanisms to have cross-ministry units to ensure this multisectoral coordination on the implementation and budgeting of child and adolescent health and well-being measure. It's about working together for strengthening the health promoting school and preschool approach, having the health personnel that are present or connected to schools, fostering the social connectedness among adolescents through school, and improving health literacy, not only for students, but also for parents and caregivers. In my next slide, and before you see it, I don't aim you to read it. I will not read all of it, but it's just for you to have an understanding of these are a copy paste of the actions that are directly related to health in schools. So this is under this multi-sectoral approach, and it's really about having detailed actions that are included and are really much related in health promoting schools. So to about adopting, strengthening, and expanding health promoting school approach. So it's a very good momentum. As I said, the 53 member states have adopted this vision, this strategy. So we have the strategy now. We need to work together, and we need all of you to work together to make that document a successful implementation. So this table is part of the annex of the strategy. And on this table, so you have on the left the key challenges that I've been talking when I was mentioning these mental health immunization challenges. And so we have listed them as rows here. And how we can work more in a vertical way. So when we can have primary healthcare for children and adolescents are as a gateway to address all these challenges, same as having conducive policies and environments, as well as engaging adolescents. But the first one that I haven't mentioned yet is how health promoting school, how empowering and strengthening health promoting school actually is a lever. It's an entry point to improve all these challenges, no? By promotion of ECD development in the preschool, by promotion of knowledge on immunization to build trust in science and public health. We have Colin working on that with the Immune Patrol that you may have heard about breastfeeding, so about promotion of knowledge of breastfeeding and nutrition, promotion of healthy styles. We heard about the physical activity from Ingrid. Then same likewise for the non-communicable diseases. You are more experts even than me on these areas. So how health promoting school can really tackle all these key challenges that we have in the strategy. So what are the next steps? Being here today, we know that we need guidance, and there are lots of guidance already. Martin will tell you a bit more on that in a minute. We are here to support countries in the implementations. We engage research to understand what works, what doesn't work. We support knowledge exchange. We are here to work as a platform so that countries and regions can share good practices, the challenges, how they overcome barriers, how they make that happen in their countries or in their region. And we are also here to coordinate monitoring progress under the strategy. So we need your experience, we need your expertise. We will convene a first online meeting gathering the 53 member states of our region. That will take place on the 26th of February. So we'll have the national focal points on health promoting schools. So that might be one of you here in the room that I'm not familiar with yet. We'll have our national focal points on children and health that have been working with us for the development of the strategy. And you are all invited to contribute so that we all reconnect and we make health promoting school a priority for the next 5 years and beyond. So with that, over to my dear colleague, Martin.
Thank you very much, Sophie. So I'm certainly not the best person to talk about the history of the SHE network here, because I know there are several people here in the room who know much more about the network and its history than I do, because I only came back to Europe about 10 years ago again, being on the WHO circuit around the world, and I was the region, for those who don't know, the regional advisor for child and adolescent health. And over this development of the strategy, which Sophie has just highlighted, it took such a long time in WHO that I even had to retire over it. So I want to give you, to bring us all on the same ground, a little bit of history. And as I said, others might know more. Health promotion in general, health promotion on the political agenda is often said started with the Ottawa Conference on Health Promotion in 1986. But actually, being in Scotland House again, there was a meeting in Scotland preceding this in a small place called Peebles, which looked at making every school a health promoting school by that time already. So there was a People Conference which was preceding the Ottawa Conference in 1986, which created a document which I looked up in preparation here, which is all typewritten with handwritten notes over it. So nothing as glossy as we have it nowadays. So that started the action, the European region. There were some pilot countries which took the health promoting school approach forward. But then in 1992, there was a European network of health promoting schools established. And this was led or co-led by WHO, the Council of Europe, with support from UNESCO. And that was then developing its momentum and moved forward at the European region. It was a funded network, which already is one of the main reasons why it could actually move. Things fell apart a bit, let me be blunt, in 2006, because the then regional director of WHO decided that all networks should be moved out of WHO. So WHO didn't want to support them anymore. So it was moved to the Netherlands. And I think if you want to know more about it, talk to Rolf. He knows all the history, how it was in the Netherlands. And then the Secretariat had multiple constructs and affiliations and was moved to Denmark and Croatia. And suffices to say, actually, these were all models which had problems. It was not as sustainable as a WHO-run network, but WHO didn't want to stand up to this challenge anymore. There were several conferences organized over the years, European conferences of health promoting schools. You see the timeline here. I will come back to the Russian one in 2019 a little bit more in my next slide, because I think this was very important to unite the different parts of the European region. But another big event was in 2016 that was organized by Didier Jourdain, again, who is in the room here, in France. And I think the main thing which caught on afterwards, after this meeting, was that every school should be a health promoting school. I think that was the sort of one sentence in the declaration of, in the Paris Declaration. And that's again a very simple sentence, which I think catches the attention of people and which you can use to promote it. In the different group works which we are having, I would like to learn from you whether it's really the case or not. Maybe it's not so much. As Sophie was saying, the WHO European region has 53 member states. All the states of the former Soviet Union are actually members of the European region. And there was always this divide, and we see it here again being in Brussels, the seat of the European Union, between the European Union countries and the non-European Union countries. And to move health promoting schools forward, it was very useful that we had a WHO collaborating center, we still have it, in Moscow, which was really doing a lot of the activities in the countries, as I say it here, where Russian is still the main international communication language, because all of these countries are moving actually to their own national languages, but Russian is often the language which is most easily understood. And over the years, we did quite a number of orientations from WHO in these Central Asian, Caucasus, Eastern European countries. We have Moldova represented here in the room as well, a country of this group. And the 2019 Moscow conference, I think, was a major event because it was really a truly bilingual conference, English as the main conference language and Russian as the main conference language. And this moved it forward. We have a Moscow declaration from there, which again, you can tell us afterwards how useful these declarations are in your daily practice. The collaborating center in Moscow was effectively mirroring the website of the SHE network in Russian language, translated all the SHE materials, and was hosting a Russian language She website. You all know what happened, unfortunately, in 2022, the invasion of Russia into Ukraine, and this led to the suspension of the Russian part of the network by the She network, as other networks have done it similarly. So basically, this website has been dysfunctional since. But there were still ongoing activities in several of the Eastern European, Central Asian countries where this orientation was taking on, and there was a specific initiative on school health services in 9 EECA countries, which carried on up to 2024. And just to say it again, WHO, of course, is neutral, and WHO is only a secretariat bound by resolutions of its member states. So the Russian Federation is not suspended for WHO. It's only for the She network as a private network, which could take an action like this. Collaborating center in Moscow is still a collaborating center, but for health promoting schools, it is effectively dysfunctional because it cannot run this function which it did before. I think here in the room, again, I don't need to talk about the She network and the materials too much. You have been using it in the Schools4Health network as well. Hof, again, has been instrumental in producing the She School Manual, which is the sort of guidebook which guided a lot of the implementation activities in countries and the monitoring of the implementation like this. So I'm pleased to say that Europe was the front runner for health promoting schools over the years for WHO as well. But then headquarters, our colleagues in headquarters, both from the health promotion side and from the child and adolescent health side, took up this momentum. Every school, a health promoting school, worked together with, you see the partners here, UNESCO, FAO, UNAIDS, UNEP, all the others, to develop global standards for health promoting schools. And they took up, again, the same slogan, making every school a health promoting school. So obviously this was catching on. Well done, Didier, with inventing the slogan by that time in 2016. And did what WHO does best in headquarters, evidence reviews, put country case studies together. So a lot of materials, and I don't want to take too much of your time because I realize we are running late already. Put all these materials together, developed 8 global standards for health promoting schools, which are supposed to work together. And you realize this is really very strongly inspired by the European work, which was preceding it. They produced materials, the global standards, the implementation guidance, country case studies. Some of you might have contributed to this country case studies, but of course it's global. I think they have 67 country case studies altogether. And there are some things there which are not so relevant for our region. For example, routine deworming in schools, which is not really our main concern, but of course it's a global concern. And then finally, WHO guidelines on school health services. So this came out in 2021, just after COVID, and I just want to digress for a few seconds. Again, many of you were supporting very strongly the technical advisory group on schools and education under COVID, where we convened at the European level technical experts who were reviewing the guidance coming from the infection control, how to implement it into schools. And we had a number of regional consultations bringing together member states, ministries of health and ministries of education, trying to mitigate the effect of the infection control measures on schools. Suffice it to say, we are moderately successful because, as we know nowadays, infection control was often very prominent, and some countries closed down schools for a long period of time, unnecessarily in hindsight. But again, these are sort of processes where you need to bring together health and education, like we are here together here, to try to move forward the agenda. So after COVID, we had hoped that everybody would realize how important health and education and health promotion is in schools, and we could run with this momentum. And as the previous introductions already said, we seem to have been only moderately successful with this because people said maths, mother tongue, is much more important than anything else. So we have this implementation guidance, which is basically updating a lot of the previous guidance we had, and what we are going to talk about, the experience of the last 3 years as well. And I think what is really needed from our side altogether now is, how do we update this global guidance? How do we move it into our region? How do we learn the lesson? to have a functioning network again, and we will talk about this over these days, which can actually look at global experience. UNESCO chair obviously will play a role in it from the global perspective as well. UNESCO needs to come to the table. The European Union needs to come to the table, and we see how we can implement what we have in the standards, what we have in the European strategy for health promotion, and how we implement this at the country level, at school level, but in network level as well. This global network has 13 levers to make every school a health promoting school. You can look up these materials, but you will realize that each of these levers can be used. Therefore, it's called a lever. But at the same time, all of them need resources and support. And there is the devil in the detail, which I hope we will work more on over these days. My last word is there was an EU-funded project 10 years ago, which was called Models of Child Health Appraised. So it looked at health systems models, how they were applied for child health specifically. I hope we would have a similar approach, that we look at models of health promoting schools appraised, that we have a way to appraise and learn lessons, what works, and where the obstacles and the bottlenecks were, which we could not address. With this, I finish. Thank you very much for your attention.
Thank you, Martin, and thank you, Sophie, for your great introduction, for setting the scene from the WHO perspective, which really looks at the European region involving 53 member states. So it's always good to think when we say Europe, it's actually the European region. And now we will look into more the part, and we have actually three speakers, and I'm happy to introduce first a video message from the Commissioner of the Intergenerational Fairness, Youth, Culture and Sports, Mr. Glenn McCullough.
Schools are places where children learn, where they explore their interests, identities, and ambitions. Places where habits influencing young people's health and well-being quickly become ingrained. This is why it is so important that schools provide healthy environments for young people to learn and to grow. At the European level, well-being at schools, both from the perspective of mental and physical health, is high on the agenda. Violence, such as bullying, has no place at school. This is central in the EU strategy on the rights of the child. And next year, I will present an action plan on cyberbullying. Prevention, reporting, and support are key. And I count on your cooperation to address this devastating threat to children's health. Children must be heard at school and in our policies. And through the EU's Child Participation Platform, more than 6,000 children shared their views on cyberbullying, directly informing the EU action plan on cyberbullying that we're currently working on. Another consultation with children is currently underway, focusing on poverty and inclusion, including access to education and health, with results contributing to the report on the European Child Guarantee. Today's gathering is a valuable opportunity to bring our community together and exchange ideas on how we can take this work even further. Thank you, and keep up the great work.
Thank you, but you probably will not hear that on behalf of the audience here. Next, it's my pleasure to introduce to you Oana Felichan, who is the policy officer from DG Education. It's a very much longer title, actually. And Oana, you will talk about the key education policies and initiatives on the EU level. So, floor is yours.
Thank you so much, and it's really a pleasure and an honor to be invited here. I also took part 1 year and a half ago to the conference that was held in Brussels on exactly the same topic, and we can see also and discuss how things evolved since then. And indeed, it's a very important forum to bring together the voice of health sector and the voice of education, and to address our common objective. You have heard from Commissioner Mikalev a bit about the next initiatives which are in the pipeline at the European Commission level. However, my presentation would like to focus on what we tried to achieve in the last couple of years, and how the topic of well-being at school have been strengthened. And I hope from this perspective to also give you a bit, also quite positive note on what we can further do and what was achieved. So from the education perspective, if we take like 5, maybe more years ago, when we were looking at well-being at school, it was very, very fragmented. The approach was mainly through the lens of supportive environments. Of course, equity and inclusion has been on the agenda, policy agenda for many, many years. However, it was very, very focused on preventing early school leaving. And from this perspective, also addressing disruptive behavior in schools, anti-bullying, also a lot on the agenda, but very, very scattered. In 2022, also in light of the COVID pandemics, but also of the declining trends on the messages we were getting through various consultation, evidence-based, evidence-informed practices, it was clear that we needed to step further from this approach. And a legal document that was adopted by the member states in the form of a council recommendation. So these are legal instruments, non-binding for member states, but which the Commission is asked to propose, and then member states adopt or not, but in this case it was adopted. It's a council recommendation on pathways to school success, which proposes, so this council recommendation repeals a previous council recommendation from 2001 on early school leaving, and in fact looks at school success and school achievement from the perspective of engagement, achievement, and well-being at school. So it's not enough just to try to address those which drop out, but it's important to look to keep them in school, but it's also important to give them chances to succeed in school. And how to do this is through engagement and through addressing well-being at school. So from this start on in 2022, well-being really started to take a more integral part and start to be recognized as a condition, but also as a learning objective. Since the adoption in 2022 of this council recommendation, we have been working with member states on its implementation, and in the framework, the strategic framework that we have, which is the European education area, there have been a working group on schools looking precisely at this framework and how to be able to implement. But on the well-being piece, we were also realized we do not have yet enough, the framework was too broad. So that is why the European Commission put together an informal groups of experts who started their work in 2023 with the objective to develop guidelines for policymakers and for schools on how to approach well-being at school and promote mental health. And these guidelines, which were issued, let me just, I'm passing this slide and then I will come back. These guidelines were issued in 2024, really build on lesson learned. Thank you very much also EuroHealthNet, the Schools4Health project, but also World Health Organization, who were invited to the discussions to prepare this set of guidelines. it didn't start really from scratch, because we commissioned a research paper, and it really built on evidence-based elements to come up to such a framework. But in a nutshell, it really takes a comprehensive approach with a high focus on prevention. And it also looks in a pyramidal approach, what schools and education can do, should do, not can do, to address well-being in a universal measure. So this is for all children, no matter what their need. And here we are speaking about the role of social-emotional education. This should be embedded throughout the curriculum, from early childhood education and care until end of upper secondary education. How to build positive school climate, what is the mission, the values of the schools, how to put this in place. Very important piece is the empowerment of learners. We cannot speak about well-being at school without involving the learners themselves, to get their voices, but also test and buy in the policies that are being developed. Foster collaborative partnership among different sectors. Here the focus is very much put on the cooperation with health sector, but also with other like migration, welfare, but also with parents and all organizations which can have a role in helping the school better deliver their mission. Then teacher training, teacher education and preparation, fully embed well-being principles into initial teacher education and training. Capacity of school leaders to address these issues. So all these are universal measures, the first fifth measures. Then we are looking both at universal measure, but with more targeted interventions. Here the targeted aspect be it in the sense of linking, of addressing the needs of vulnerable groups in order to, again, put in place a preventive approach. So safe school to address and prevent any form of violence. Here we are speaking bullying, cyberbullying, gender-based violence. Digital well-being in the digital age. This is a huge topic and it's evolving extremely fast today. Uphold fundamental rights, but by safeguarding core enablers. Here we are speaking about the right to play, the role of sports, physical activities, how to incorporate more movement in the lessons, the role of arts, culture, and element like this. And then again, provide continuous professional development to support educators, very much also in a targeted way that every educator should understand and address diversity in the classrooms. But also a school that needs to prioritize equity, inclusion, and diversity. As I said, this was for a long time on the agenda, but if we look through the lens of mental health concerns, we also see the overlap of needs. Learners with low socioeconomic background, learners with certain disabilities, they are more at risk at developing mental health concerns if not properly addressed, or if there is not a caring and supportive environment, which can act, in fact, as a protective factor. But in spite of all this in place, all this preventive measure in place, and this is the 11th recommendation, what happens if indeed poor mental health, still anxiety, depression, and so on. And here it is crucial cooperation with professional schools, but also capacity of teachers to observe when this happened. If you have further questions, I'd be happy to exchange during the break, but I do not want to take too much time on this. So after these guidelines were published in May 2024, we also entered into a period of implementation with member states. We are strengthening the tools, the funding tools which are available at our level. In particular, Erasmus Plus program, there is a specific priority on well-being at school, and it got quite a lot of attention in 2024 as it was the annual theme both of the e-twinning and European Innovative Teaching Award. As well, we launched, based on these guidelines, we launched a self-assessment tool that schools can use in order to, kind of draw a picture of their school or where they are situated in relation to these topics. And since we discussed so much about children voices, we could not go ahead without translating these guidelines with children and for children in a child-friendly version. Next steps, PISA results, very bad, very worrying, and we really need now, with this overall approach in mind, to zoom in on basic skills, reading, mathematics, science, digital citizenship. The Scottish example mentioned in the beginning, it's really an inspiration where we should be heading on. Again, besides the basic skill decline, very complex and interlinked factors, I will name just some of them. So low socioeconomic background, teacher shortages, decreasing parental involvement that we experience, and increase of digital distraction. So huge topics to look into in the next years. The action plan on basic skills that the Commission adopted in March this year sets up 17 actions for the European Commission, grouped in 3 areas: boosting teaching and learning, supporting educators, and enabling supportive environments. This is the things we will be working on in the next years. But it also does not work in isolation, so it ties really with other important initiatives, and you will hear from my colleagues on the European Child Guarantee. And as I said, as you heard from the Commissioner, a big topic and very high on the agenda, the upcoming action plan against cyberbullying. This we expect for publication in February. It is led by colleagues in DG Connect. And really the focus is how to better protect and raise awareness on these issues. And I think with this I have covered my time, but I'm very happy to exchange in break on
Thank you, and to not disappoint you, there will be, hopefully, we'll take some time for a few questions, and otherwise there's enough opportunity to interact. Thank you very much, Oana, for your very inspiring story, and I think it's quite historic how also DG Education moves much more into the health and well-being side, and thank you for your great work. And now we'll move to the next speaker, which is Mathis Porches, I hope to pronounce your name correctly, who will look more from the social policies. Please go ahead. You want to stand here? Okay, 8 minutes for you.
That's Steph. Well, good morning, everyone, and many thanks for the invitation. In these 8 minutes, I'll try to speak about a topic which is related to schools, but which is also related to many other issues related to child poverty more broadly. So this makes it even trickier, this 8 minute timeline. But yes, to kickstart, then I would just present broadly the political framework that we have at the European level. By the way, I'm Mathis Porches, working for DG Employment from the Commission, and so more working on child poverty and poverty-related files. So that's why I will focus on those. So basically at the European level, we've been dealing with child poverty and child well-being and the social inequalities related to it since quite some time, and notably since 2013 with the Commission recommendation on investing in children and also in child well-being. Following this, we had also what we call the European Pillar of Social Rights, which includes one key principle for our today's conference and our work more broadly, which relates to children. Basically, this is Principle 11. And this principle stress the children's rights for being protected from poverty, but also to have access to early childhood education and care of good quality, and for children with disadvantaged background to have access to some support measures. And related to this pillar, European Pillar of Social Rights, we also had an action plan to make the principles a reality on the ground. And in this action plan, there was also the setup of targets, concrete targets, poverty target, poverty reduction targets, but also child poverty reduction targets. And so with this, member states, the EU more broadly, made the engagement committed to reduce child poverty and the number of people and the number of children in poverty by at least 5 million by 2030. And we also had the EU Child Rights Strategy, which was mentioned. And I will then talk about the European Child Guarantee, which is the main initiative at the EU level to address child poverty and its negative consequences on child development. Just before diving in this, just to present a little bit of figures related to poverty development since 2019, which is the baseline on which we rely to monitor the progress towards the 2030 targets, child poverty reduction target, the poverty reduction targets mentioned just before. And as you can see, there is a need for more progress, more broadly, related to poverty of the overall population. We see a slight decrease in the overall number of people in poverty. But when it comes to children, this is not the case, which is the alarming state of play when it comes to this. So since 2019, there's been actually a slight increase. You can see it with the orange columns. This is the the number of children in poverty, which has not reduced since 2019 and slightly increased instead. So what do we do at the EU scale to help those children who remain unfortunately in poverty and to try to provide them with equal opportunities? We, as the EU, put forward the European Child Guarantee, which relies on the principle that we should break the cycle of disadvantage at the earliest age possible, to try to really help children in poverty, growing in poverty, have the same opportunities as the others, to try to integrate in the labor market later in life, with also good, strong school education, and so on and so forth. And so how we do this, we focus on services, and obviously schools are one of and education is one of the service which is of key relevance here to the fight against the transmission of poverty. You have the Council recommendation, which is the same as, same type of legal instrument as was mentioned by my colleague from DG EAC. So it's like a recommendation adopted by member states, but it's not legally binding. They have the responsibility to implement it. Us as a Commission, we support them in the implementation. And yes, I will just give you a broad overview of the gist of this recommendation, the substance of this recommendation. This basically focuses on children in need, what we call children in need, children in poverty, who are basically living in a household below income thresholds, to put it shortly, but also related to other poverty measures. And we also recommend member states to take into account specific disadvantages by other for other groups of children within this overall children in need group. So, for instance, paying specific attention to homeless children or children with disabilities and so on. The services covered by the guarantee to try to break this cycle of poverty transmission from childhood to adulthood. As I say, education features prominently here. So in the recommendation, member states are recommended to provide children in need, children in poverty, effective and free access to early childhood education and care, to schooling and also all the activities, school-based activities, to at least one healthy meal every day at school, healthcare. So those services should be provided free, meaning that children in need can access them without having the parents having to pay a fee. And then we also have two last services or goods mentioned in the recommendation, which relates to access to healthy nutrition and also access to adequate housing. Those services in the recommendation are not within the services that should be accessed freely, but they should, member states should still provide them, provide children in need with an effective access to them, and so it must be also affordable for the households with children in need. So as you can imagine, the schools, and as mentioned before, the schools play a key role in the implementation of this key instrument to combat child poverty at the EU level in many ways. I've mentioned, for instance, the delivery of quality school meals, and we can see that there is a lot of impact on the transmission of inequalities throughout generation, through also educational attainment and health outcome of children. I can think, for instance, about a study conducted in Sweden, where you have a universal school meal scheme, which provides healthy meals to all children for free. And there's been a study on its impact, and we can see that there is like quite a strong positive impact, especially for disadvantaged children, and that having access to this type of meal allow them to achieve better in schools and also have like a stronger health outcome. And so we clearly see some correlation between the delivery of school meals and educational attainment and the fight against poverty. And you have also other key services which can be delivered or supported by schools, ranging from health checkup to also the provision of physical activities, which all have a long-term effect on the capacity of children to achieve good results in school, and also try to integrate later on the labor market and not fall again in poverty once reaching adulthood. But we have key gaps still in the implementation of the guarantee. The PISA results was mentioned, where we see huge disparities in school achievement still. So, and here you have a graph in terms of showing the gaps in access to early childhood education and care, where we see that the children most in needs actually are the one who benefit or can participate less to this early childhood education and care. And yes, so it means that we still have to tackle financial, non-financial barriers to provide those services. I will, yes, be quick. Yes, just to have just say a few words on the implementation of the guarantee. So basically, each member state nominated a child guarantee coordinator in charge of coordinating the implementation of this important initiative at national level. Member states are the one responsible for it, so they play the key role here. And just as a word of conclusion, as I guess I'm running out of time, I would strongly encourage everyone also to try to reach out to national child guarantee coordinators to see how I guess everyone can help each other in this endeavor of fighting the negative impact of poverty on children and their development. And the child guarantee coordinators are the one which could also be of help probably for your work on school enhancing, health enhancing schools, and the promotion of it at national level. So many thanks. I'm sorry, I think I have not managed to cover everything, but I'd be happy to reply to questions. Thank you.
Thank you so much, Mathis, for your very comprehensive talk. And after the three DGs, their different perspectives, it's really, the landscape is developing. So we now did the EU, we did the World Health Organization, and now we look on the global level. We have two speakers here, one from UNESCO, one from UNICEF. First of all, I'm happy to introduce Monsieur Xavier Hopital, who will address his talk online from the UNESCO office in Paris to talk about their work in the field of health and schools. He's from the section of for health and education. So Xavier, bonjour.
Yes, bonjour. Thank you so much, Ruf. I hope that you can see my presentation.
We see you at the moment.
You see me.
Yeah.
Okay, so let me see.
Just a moment.
Okay, let me try again.
I see you double now, even better. And your slides are coming.
Yes.
Yes,
I can see my slides.
We can see your slides. Is
Great.
it full screen possible, David? Okay, then we do it like this. Yeah. Okay.
All right.
It's
All
okay.
right.
We can see your slides clearly, Xavier. Go ahead.
Great. Thank you so much. So I'm going to talk about the health promoting school framework and an evolution that has been proposed by an interagency group on school health and nutrition after a while to make it more sustainable if possible. So let's start with how the UNESCO's role in strengthening collaboration between the health and the education sector. Well, UNESCO works through 5 core functions: laboratory of ideas, clearinghouse, standard setters, catalyst and motor for international cooperation, and then capacity building. And through these 5 core functions, UNESCO supports education authorities, take the leadership in 6 components of a holistic approach to education for health and well-being. And in doing so, the 6 components are about policies, teaching and learning, learning environment, reporting, referral care and support, partnerships and community engagement, and data evidence and learning and innovation. Right. So in doing so, through the 5 core functions and acting at the level of those 6 components, UNESCO assumes that the collaboration between health and education can only work effectively if both sectors endorse their own responsibilities and are coordinated. So in order to strengthen the education sector to actually act on its own responsibilities, for instance, if we take the core function of standard setting, UNESCO together with WHO co-developed the health promoting school standards, global standards and indicators, which provide a shared framework for both sectors. It helps with coordination, but also it says what the education sector should be doing in terms of curriculum, in terms of including learning environments, in terms of reporting, etc. For instance, this has led to develop better education resources in Belarus or to pilot the standards in North Macedonia, to give 2 examples in Europe, but also there are other examples of work. For instance, in France, UNESCO builds capacities of teachers and school directors to integrate psychosocial skills into teaching and learning processes. Beyond Europe, a global mental health and psychosocial support teacher guide and school health services guide, which are jointly developed by WHO, UNICEF and UNESCO, will be providing technical support, will be providing practical tools for school-based support, strengthening the health promoting schools climate and services. So those are 2 examples of 3 examples of action undertaken by UNESCO, and which are covered by the first objective of its strategy on education for health and well-being. This objective is to make sure that learners are empowered by, to ensure that learners benefit from resilient school health systems that promote their physical and mental health and well-being. And in complement to this first strategic objective, UNESCO also undertakes activities under its two other strategic objectives, which are to empower learners by good quality, gender transformative, comprehensive sexuality education that includes HIV, life skills, family and rights. So this is UNESCO works on global work on comprehensive sexuality education, social emotional learning, life skills, digital well-being, and comprehensive sexuality education, which support the health promoting school standard on teaching and learning, whether the pillar on teaching and learning, for instance. Another strategic objective, the third strategic objective of the UNESCO strategy, is about benefiting from safe, inclusive learning environment free from all forms of violence, bullying, stigma, and discrimination. And under this strategic objective, UNESCO works on bullying, cyberbullying, technologies facilitated violence, school climate, and gender equality. And this aligns with the health promoting schools environment pillar. Now, if we look at the health promoting school standards, they are absolutely very, those standards really helped bringing together schools and health sectors and define responsibilities for each sector and define what needs to do to create a health promoting schools. However, we've seen that in terms of implementation, there have been some challenges and difficulties, but in terms of budget, in terms of coordination, in terms of institutionalization. And this is with these challenges in mind that the Interagency Group for School Health and Nutrition, which gathers quite a number of organizations, we have the logos here, that have been working to institutionalize health and well-being into education sector planning. Education sector planning, for those of us who are not from the education sector, are plans, long-term plans, which guide political decision-making, budgeting, partnerships. In a nutshell, if something doesn't appear in education sector plans, it's akin to not being there at all. And when you try to implement activities for health promoting schools, for instance, which are not in the education sector plan, it might work as long as there is an external funding available to do it, but it might end up not being implemented in the long run, which is why a brief has been developed to convince decision makers that it is of interest. And a handbook has also been developed to make sure that technicians, education sector planners can take health and well-being into consideration when they do the plans for the next 10 or 15 years for the country. So the briefing note, as I was saying, gives different arguments for decision makers and for technicians to make a case for integrating health and well-being into education sector planning. And sorry, I was going too fast. And the handbook provides resources and tools to conduct the analysis of current implementation modalities of analysis of first analysis of the status of health and well-being. What are the issues? What are the effects on education? What are the available indicators and data sources? How can we disaggregate data? And you have a series of acronyms. I'm not going to go into that. You can have the details in the handbook to help you finding data for that. Then the handbook provides you resources and tools to do the analysis of policies and provisions implemented by the education sector to integrate health and well-being. So you look at the policy environment, school health and nutrition program, and the resources and implementation capacity, again with a series of acronyms to describe the tools and data sources that you can use. And once you've done that, you can go into formulating priorities and key strategies, which help to prioritize the issues within school health and nutrition that need to be implemented, which help to assess the school health and nutrition among national education priorities and to mobilize stakeholders and advocate for school health and nutrition. The handbook and the briefing note are part of a broader program of work, which is called Planning for Healthy and Thriving Learners. So we can see the tools, which are the briefing note and the handbook, but these come together with technical supports, which is delivered to country to strengthen their education sector planning processes to integrate health and well-being. We will be creating a pool of experts in 2026 so that we can have a higher capacity to support countries in their planning processes. There is a training program which is being developed by the International Institute of Education Planning, which is a 100 course delivered online and which is delivered on the campus of IIEP, and which gives 4 microcredits that can contribute to a master's in education sector planning. And there is also a mapping of country planning cycles, which help identifying which countries are going to review their education sector plans next, or which are going to assess them, and which offer possibilities to integrate health and well-being. So in a nutshell, what we hope with that is that health and well-being will not be an add-on, but will be fully integrated and institutionalized by the education sector, so that in coordination with the health sector, it can act on its own responsibility in order to make truly health-promoting schools. And this is what I had to say today. Thank you so much.
Thank you, Xavier, for your presentation and introducing this new tool that I think could be very, very relevant for the future, also for health promoting schools here in our region. Now I'm happy to give the floor finally to Maida Basic, who is the Regional Educational Advisor of UNICEF Europe and Central Asia. So, floor is yours.
I hope
what
so.
can I say?
Negotiated. Thank you so much. Thank you. It's a real pleasure to be here today. It's my first meeting of this kind, I have to say, but great to talk to you about UNICEF experiences in promoting well-being and health through schools. This is the agenda. It's priority, very high on our agenda, and not only in education and health, but also across other sectors where we work: child protection, social policy, adolescent engagement. So really, in UNICEF, all hands are on deck behind this mission. So building on and just check on what other colleagues have presented, I will speak briefly about our approach to promoting health and well-being in schools. I will focus on MHPSS, mental health and psychosocial support as a key priority that has emerged and was mentioned today a lot. I will reflect then a bit about our collaboration with WHO, because I think some of the work we have done jointly also, and some of the lessons learned are kind of pointing out to good ways forward in this joint effort to promote health and well-being. Just to provide a bit of a framing for our work, and I think colleagues from WHO and all of you who have read the strategy will recognize this. So we work around these 4 pillars of interventions when it comes to promoting child and adolescent health and well-being, and first being health promoting schools and preschools, but also primary health care, conducive policies and environments, and then engagement with children and adolescents. Obviously, schools and working through schools and preschools, a key kind of venue and pillar through which we work. When it comes to promoting health and well-being, UNICEF works on several tracks. First one being really efforts to create a safe, inclusive learning environments, and that consists in our work with the schools to reduce, for example, bullying, violence, online, ensure online protection for children engaged in digital learning, etc. We also work on supporting policy and system changes, and that could include, for example, making sure that there are national nutritional standards for school meals, etc. Ensuring access to support services, a lot of work around at the school level, ensuring, for example, availability of referral systems for children who need additional support, and usually mental health and psychosocial support, raising awareness and reducing stigma. A lot of work in that area through our social behavioral change colleagues in other sectors on really addressing, in particular on mental health, the stigma, and then raising awareness of issues, not only mental health, but obesity, etc. As I said, I will talk about more about providing mental health and psychosocial support. So I left it for the next slide to say that in promoting mental health in schools, our approach is three-pronged, and you may have seen this before, focusing on the prevention, promotion, and response. On the prevention, we work with all children in the school to really raise awareness and of the importance of well-being, but also speaking out, seeking help, etc. Under the promotion pillar, we are focusing on the most vulnerable, or those who are at risk for various reasons, for experiencing trauma, for experiencing perhaps displacement, etc. And then in the response part, we're really focusing on those few children who need a specialized services, usually provided outside of the school. Some of the types of interventions that we promote in schools, and I think some of these were mentioned by the colleagues from the European Commission, who also work on pathways to school success, are obviously promoting social emotional learning in the curriculum through teaching practices. And we're talking about, obviously, building self-esteem, empathy, problem solving, healthy relationships. The second kind of key group of interventions is linked to supporting educators' well-being. And I think the teachers are often expected to provide and to know how to provide mental health support, but they often need mental health support as well. So there's a lot of focus on teachers as well, but of course on equipping them with the capacity to support students, to identify early stages of mental health issues, to support children dealing with anxiety, with trauma, etc. And then the third set of interventions that we promote is what we call whole school approach. So mental health, psychosocial support, literacy, as school-based interventions, referral mechanisms, etc. And previous colleagues were mentioning this importance of well-being and how do we really embed well-being and not make it an additional burden on the schools. And I was thinking about the experience I had in Finland some time ago when I visited a school, and the principal was talking to us about the school, the vision for the school and objectives. And then she said, our objective is to promote well-being and learning. And then she paused and she said, in that order. And this was such a powerful statement on the importance of creating this school ethos and also saying it explicitly and putting it explicitly on the banner of the school, that well-being precedes the learning. outcome. And speaking, someone was talking about powerful short phrases, and I thought that was really, really powerful. So I think UNICEF works really to try to develop that ethos, the school ethos, where the well-being is prioritized. I shouldn't say over learning because I'm an educator, but you know what I mean, the well-being as a kind of bedrock for learning. Couple of examples from the work we are doing in the EU member states and also in a broader region. So in Poland, and this was part of the Ukraine refugee support, we have developed a set of training tools that address inclusive education, teachers dealing with ability to deal with trauma and diversified classroom that suddenly were receiving Ukrainian refugee children into the classroom. So we have developed a couple of training tools. They are available on the Learning Passport, and so far trained about 9,500 teachers. Now, this the government is planning to kind of scale up and become part and parcel of the teacher professional development. Bulgaria, similarly, we worked on a whole school approach, and this was very much linked to the reducing bullying and violence in schools, so developing specific tools for teachers, for principals, for school community to reduce violence. UNICEF is engaging on several TSIs with EU member states, and I should mention the most recent one that we are doing in Cyprus, Italy, Andalusia, and I'm forgetting now, and Slovenia, on youth mental health. The second one I mentioned here is the TSI for Safe Schools in Romania, and quite a lot of work around assessment. A technical support instrument. Oh, apologies. I'm sure other colleagues are familiar with it. So technical support instrument, which is basically supporting and accompanying government in the reform of some aspects of their educational or health system. Similarly, in Croatia, we have supported the Schools of Support program, again, dedicated to mental health issues and strengthening teachers' capacity, but also the whole school community capacity to identify mental health issues and be able to address them. And also in Montenegro, in one of the accession countries, we have worked in the with the government on integrated social and emotional learning through all stages of this, so from preschool to upper secondary, and they're now available and being implemented in the classroom as part of also teacher training. Now I just have to see, how do I, yes, okay, all right. So don't get scared by this slide. I only wanted to, I'm putting it here just to emphasize that when it comes to mental health and psychosocial support, we talk about schools and we talk about health system, but in fact, to really tackle the problem, we need a diversified sectoral approach. So in UNICEF, given that we are a multi-sectoral agency, we work through our adolescents in participation section on digital space, safety, well-being in digital platforms, for example. Schools I have already mentioned, and healthcare, I'm sure you would recognize some of these interventions. We also work through our child protection sector to strengthen social services, and also with the communities. And I mentioned earlier on stigma reduction, that the critical elements of tackling the issue of mental health and psychosocial support. So similarly, as we work like this in UNICEF internally, we are also promoting this kind of approach amongst the line ministries. So promoting the collaboration between Ministry of Education, Ministry of Health, Ministry of Social Affairs. And so we truly believe that multi-sectoral approach is the key. And speaking of collaboration, I will close just with some reflections on our collaboration with WHO. You have heard from colleagues, we have worked together on the child and adolescent health and being strategy, and we are very happy to support member states in its implementation. But I also wanted to point out another joint program that we have embarked on in 2022 with WHO in 13 countries. They're across, this is a global program, and there are 3 countries from our broader region, Albania, North Macedonia, and Serbia, that are part of this program. And the program is addressing kind of systematic bottlenecks to ensuring access to quality mental health services, protection and care for young people. It's focusing on leadership and governance, on data and evidence and information systems, on promotion and prevention of mental health, and on service delivery capacity. And as of 2025, we have just published the progress report. We have reached, and you can see here, about 8.8 million service providers, children and adolescents with various activities to this program, and about 330,000 children who are in direct contact with care services, multi-sectoral care services. And why I'm mentioning this is because we have already beginning to draw some lessons from this collaboration. It's again a massive one across 13 countries. And what we have identified in some of the enablers is what I'm projecting here, that really the most effective way to improve health and enhance learning outcomes is to ensure cooperation, really determined cooperation between schools, teachers, families, and communities. Again, don't have to repeat this one, but obviously it's coming up and again, pointing that there is a gap. Multi-sectoral collaboration is essential and needs to be deepened and promoted to really result in the best possible effect. And I think this whole school approach that I've talked about time and time again comes as a critical aspect of our interventions, and it's a kind of sine qua non of this approach. Fostering local partnership as well has been one of the enablers, and really ensuring that our programs and policies are culturally appropriate and culturally effective. And then what has come out really from discussions also with countries is that the regional collaboration and exchange of knowledge is critical, and ensuring that there are platforms for governments to exchange, to learn from each other is particularly effective. And I think UNICEF from our side really is trying to do, and with WHO, to create these opportunities for government and actual stakeholders, the real stakeholders, schools, communities, to exchange and learn from each other. So I will stop here. I hope I've given you a bit of an overview of our work, and I thank you very much for your attention.
Thank you so much, Maida, for your very inspiring talk. And this session was about the policy landscape, and you might be a little bit dizzy because there's so much happening. Isn't it great? I mean, all these developments. And for us, it's now before the coffee. How can we synthesize this, and how can we reflect on this during the rest of the conference? I know we don't have time for a long discussion, but I agreed with Gabriela there is time for 1 or 2 questions. And I know we have people from schools here. Maybe you have a question. This is the opportunity to talk to these people who make these policies, who are working on it. Just raise your hand and don't be shy. It's okay. You'll survive. Who would like to ask a question? Yes. You go. Okay, great. And can you say your name and where are you from?
Polonca Truden Dobrim from the National Institute of Public Health from Slovenia.
Hello.
I would like just to express that we are very thankful to these people, that they did so much work in recent times and prepared these very important documents for us. We see a lot of synergies in the different work from WHO, from the UNICEF, as we also are a part of the TSI project on obesity and stigma and mental health. So Slovenia is one country in the project. And I would also like to stress the importance of working for the child guarantee, as it's another issue that supports our work. So just to say that all the things that are coming out now are very important, and we would like really to be in a way supported in implementable working in this field.
Thank you so much, Blanca, for giving this comment. And there's one more right at the, oh no, almost right at the back. And just say your name. That's you, Saoirse. Yeah, please.
Say your name. That's easier. Hi, everybody. I'm Saoirse McGowan from the University of Galway in Ireland. I too was very excited by the extent and the depth of the work that was presented to us this morning. I've never seen quite so much presented from such a broad range of organizations, and it links quite well. I think back to the introductions where you were pointing out the importance of us being in Scotland House. So I just wanted to pay a little tribute to Ian Young, who was one of the founders of Health Promoting Schools, as many of us know, and a very, very important and excellent colleague. My question is for the international groups, particularly the EU, the UNESCO, UNICEF and WHO. Is there a structure in existence for you to talk to each other about the various initiatives you're involved in? Is it part and parcel of the structure of your organizations? I'd be very interested to hear about that. Thank you.
Yes, so who can I ask from the EU representatives here? Maybe Oana, you want to respond to that from DG Education? Yeah, try.
It's in fact precisely what we have been trying to achieve in the past years, because so we had this framework of cooperation, which is the European education area, and where there were several working groups, which the mandate ends this year, but we will be looking forward to another cycle. And through this, we have tried to build links with the health sector, with what's going on from the social side, and so on. So this is a fora that will continue. Just to give you an example, so in this cycle, we had several working groups. One was looking at early childhood education and care. One was looking at school education from the perspective of pathways to school success, but also learning for sustainability and green education. Another one on vocational education and training, higher education, and 3 sectoral groups. So this cooperation, we hope, will continue. So,
and maybe to add, or maybe you want to, yeah, please.
Well, many thanks for this question. Just to add as well, that's for the child guarantee sides, we have quite a structured way of working with member states, and I tried to mention in my presentation, short presentation, the national coordinator who are in charge of implementing the child guarantee at the national level. And so they are basically the one trying to reach out to all the services covered by the child guarantee, ranging from early childhood education and care to healthcare, housing, and also education, most importantly. And so with those, we organize a regular meeting at the EU level, at least twice a year, and we try to focus on specific topics. For instance, last year we focused on school meals with the help also of WHO. And we also focused on healthcare, education, and with UNICEF and other partners. So this is like quite a structured way of working together. And themselves, they also have to try at the national level to try to coordinate with other stakeholders, ranging from other ministries, but also schools and local authorities and so on. And so, yes, just mentioning one last point, I forgot to mention in my presentation, I'm sorry. So basically, in the implementation of the child guarantee, we saw gaps, and we will try to reinforce it. We have a mandate to try to reinforce the implementation of the child guarantee, and we will come up with a proposal as a commission in the next year. And so, yes, I mean, all support regarding this will be welcome by sharing ideas and so on. So, yes, many thanks. Sorry for hijacking this.
You did actually, but you did it great. Thank you. Well, it's not much different when you hear this, what we do on a local level, you know, in your own community, in your countries. The intention is there. It's great that these initiatives are taking place. And now, of course, we're going to talk, how can we do this in practice and implement all these things? And that's, I think, the rest of the conference will be about. The presentations will all be on the website. I have to say. And actually, during the Xavier's talk, there were over 100 participants online. So thank you for those who are online. And now we'll have the coffee break. And we start again at 11:30 sharp.
All right. So welcome back. We had a very, very productive morning already. And just to stick with the timing, because we have a very, very interesting conference, I ask that you slowly take a seat as we head into our next session. So welcome back, everyone. I really hope you had some time to recharge a little. I know the coffee break was very short, but this morning's sessions, I think, really set out the important landscape at a European level, what the gaps are, what the opportunities are, and how we can continue working together with so many interesting tools, resources, and activities planned and in the pipeline. And now we transition into this next session where we're going to be looking at some really promising and very interesting national and regional examples of how countries are creating the necessary frameworks to embed healthier school environments in the ecosystem. So this session will really focus on the learnings at a national and regional level from two countries, from Belgium, the Flanders region, as well as the Netherlands. And they will be diving into what they've done, what they plan to do, and what impact they hope to have in a school setting. So without further ado, I'd like to introduce our very first speaker for the session, who is Elke Hilbert, who is the Policy Advisor for Health Promotion and Early Detection at the Department of Care at the Government of Flanders in Belgium. And she will be sharing with us how the Flemish government is really putting prevention at its top priority within school settings. Elke, the floor is yours.
Yeah, okay. Flanders has a long tradition of working with multi-year health targets in preventive health. The most recent target ran from 2015 until 2025 under the name The Flemish Live Healthier in 2025. Within that target, we had a specific ambition for education. That by 2025, 80% of all schools, primary and secondary, have a qualitative preventive health policy. On 15th of December, so that's within 2 weeks, we will have a new target in a conference. We will launch a new target for children and young people. Will be very important in that strategic framework. The reason is, of course, simple. We've heard it a lot today. Early health gains have lifelong effects, and schools reach everyone. Importantly, in this new health target, we will not longer try to change everything all at once. Every setting, every age group has its own needs, has its own change that has to be made to be more effective, more impact. So we will try to focus so it's more feasible, more sustainable, and likely to lead to more impact. Education will be the first setting we will try to have more impact. What do we know? We have a prevention survey which is conducted in 2015, 2019, and 2023, and has two components. One part looks at concrete initiatives in settings. Schools, by example, how many are you offering healthy meals? Are you supporting social emotional skills? Are you having a smoking policy? The second part measures the quality of school preventive health policy. It looks at how schools systematically work on their health through a good policy. Is their structure? Is their policy work structured? Is there participation from the school team? Is there evidence-informed approach? These factors are combined into a qualitative score. But the evaluation gives us a clear picture. In both cases, we did not reach our goal, and we also saw lower results than in 2015 and 2019. It raises questions. Why is this happening? To understand the underlying reasons, we commissioned an in-depth study. The study gave us clear insights of what is the reality of schools. First, schools stay close to their core mission, educating, teaching. Health is relevant, is important, but it's not really something they often do as something structured throughout the whole school. Second, the expectations are not well defined. Schools are unsure what is a good health promotion or preventive policy. What is really essential, but what is optional if you have more time. Third, the wider system around them is fragmented. Multiple policy domains in the Flemish level, persistent gap between preventive health and education, and diverse local contexts. The preventive organizations provide valuable tools, but they're only one small part of the reality of schools. And fourth, and it's important that policy-making capacity in a general is tackled, not really specific to health, but if a school doesn't have structure or routine or clear communication routes or agreements, that won't be the case for health as well. Together, these insights explain why many schools are struggling, not due to willingness, but due to system-level barriers and lack of clarity. So we have some key recommendations. The first one is clear for us and a very important one: reduce fragmentation. Align actors, align health teams. Today, schools in Flanders receive many high quality, but many health initiatives from many different actors. It's overwhelming for schools. Schools told us very clearly, we need one coherent story about health, reducing fragmentation so that everybody knows everything that's happening around the schools. Clarify the supporting roles, more beyond just information referrals, because much of the current help and support in schools is with information. We have websites, we have packages. It's very helpful. Schools say it very clearly, it's helpful, but it's not enough. School needs really hands-on, context-aware support, and needs people who translate the theory into practice on a school level. The third one is create a coherent, streamlined offer. Schools don't need more materials. They need usable selections, a slim, coherent package of evidence-informed tools. So less volume, more clarity. That was something they said very clear. Also develop a significantly brand and a recognizable brand and communication. Right now, health comes from very many different organizations, each with their own style, their own channels. But now they say we have a need for one brand about health. So we need, okay, this is the brand, something about health, and we can trust it. It's from the government, we can trust it. Provide structural coaching close to the school. And the sixth one, for us, of course, very important, ensure strong central coordination and governance. To make it all stick, we need strong steering, a strong framework, a coherent monitoring, and aligned initiatives to prevent new fragmentations, and that the change will be sustainable over time. So what will we change? Previously, the WHO indicated that a multi-level approach is very essential. So that's also something we did here. With this strategy that I will present to you, we have coordinated and made commitments with various policy areas, including, of course, education, environment, sports, who all have a role in the promoting of health in schools. Tomorrow, for example, I will be meeting with the cabinet of the Minister of Education, which is for me a very, very important milestone for the next step in this process. So, concrete, what we will do. First, we are fundamentally changing how we are going to communicate with schools. So, like I said, now we have a lot of organizations, mental health, nutrition, sports. They all have their own branding, their own emails, their own campaigns. School tell us it's overwhelming. It feels like a tsunami, a well-intended tsunami of information, but the structure is a bit difficult to see. So we are moving to one shared brand with a strong communication platform. We will build a central platform structured around customer journeys. We did a few customer journeys for teachers, school leaders, pupil supports, and others. We know why they do the things they do and why they don't, most importantly. Each user will be directly guided to what they need. Not every information all at once, but really per customer journey. So we will concrete in 2026 and in 2027, we will build one website, one shared brand, coordinated communication strategy, including national campaigns on health in schools. The second shift is about the content itself, the offer that school is receiving. Today, each lifestyle team has its own materials, its own tools, its own campaigns, but it leads to fragmentation, duplication, and a choice overload. People have to choose every single time, and there is a bit of competition in the schools for attention. So that's why we are moving toward a coherent, slimmed down, and also new integrated lifestyle offer. Partners will collaborate across horizontal teams. For example, around social emotional skills, it's something I've heard a lot today that it's very important, but that is one of the first horizontal package we will develop in 2026, along with the partner for suicide prevention, mental health promotion, prevention of drug and alcohol use. They will all work together on one package and not 6 packages on all specific teams. So that for us is a really big step. But also about digital health, self-regulation, that's more for in the future. The new offer will also have clearer layers. What is really need to know, need to do for a school, and what is nice to know, and if you have more time of a bigger problem in your school, then we recommend this and that extra. So in 2026, we will audit all existing materials, remove overlap and complicity, and also develop one holistic lifestyle package. So if they just want to work on a lifestyle approach, we don't have that right now, but then 2028, we will have that. So the last change is we will have more support around the school, close to the school, not only online or through websites, but also close to the school. They don't need more documents. They need somebody really tell them and at their specific context. So coaching will be provided from the local preventive partners. I think you say it in English, health makers. That's the people who work for us on the more local level, and they will have an extra role, so extra people on the ground to really help the schools. And also, of course, we know that schools also need thematic expertise on alcohol, mental health, sexual health, nutrition. So we also have external specialists that can come to schools or online or to workshops and on demand give them information about concrete actions on the topics they want to. So in 2026 and 2027, we will develop standardized support tools and intake tools, a policy scan, planning and follow-up templates, all written in school language, not health language, but school language, and align it with the routines in a school. So thank you.
Thanks, Elke, for your fantastic presentation. I think the message conveyed by Elke is clear. Schools don't need more documents. They need structured, cohesive approaches with the support to back it up. And this is why it is so great that we also have the Dutch example coming up in our presentation that really focuses on the Healthy School program as a framework to help schools better embed well-being in their structures. So I would like to introduce Kirsten Molenaar and Myrthe Klomp, who will be presenting on the Healthy School program. They both come from the National Institute of Public Health and Environment in the Netherlands. Myrthe, Kirsten, the floor is yours.
So hello, everybody. It's really a pleasure to be here. My name is Myrthe Klomp, and I'm here with my colleague Kirsten Molenaar, and we work at the Dutch National Institute of Public Health and the Environment. And I'm going to present, or we are going to present about the Dutch Healthy School program. With this program, we make healthy living, learning, and development of pupils and students the norm in the Netherlands. Yes, the Healthy School program is a unique collaboration of 5 different organizations. First, we have the 3 education councils representing the different education types. Then we have the National Institute of Public Health and Environment and the GGD-GOR, and that's the National Organization for the Regional Public Health Services. We have 25 of them, and at the Regional Public Health Services, they have several healthy school advisors, and they are the ones who are in contact with the schools. And together with these 5 organizations, we bring together education and health promotion, and that results in Healthy School. And we are financed by 4 different ministries. But we don't do this alone. We do this together with the National Knowledge Centers. We have 10 different health teams within Healthy School, and you can see them on the slide here. And every theme has its own National Knowledge Center, 1 or 2, and they provide us all the knowledge about that specific theme. Also, we try to involve school professionals as much as possible, for example, by the Healthy School panel. And lastly, we have a Healthy School research network to exchange national and international knowledge. And the Schools4Health project is one of the examples. The Healthy School program helps educational professionals to implement and work on health and well-being of pupils and students, and doing this in such a way that it really becomes part of the routines of the school. The program focuses on 4 educational types, and it's based on 2 scientific approaches: the Plan, Do, Check, Act cyclus and the whole school approach. And these approaches are translated to the Dutch context together with the target group and form the Healthy School approach. So the Healthy School approach is a structural approach. Schools go through 3 phases. So we make sure they're not missing any essential steps. And it's also a school-wide integral approach that's based on 4 pillars.
education, school environment, signal, and policy. And these pillars are derived from the 6 pillars of the whole school approach. The healthy school approach focuses on 3 factors that determine the success of the implementation of this approach. And this is creating and sustaining a supportive environment, the participation of pupils and students, and the involvement of parents. And here you can see a schematic overview of the healthy school approach. You also see the 3 phases in this overview. Ideally, schools start with building a solid foundation by focusing on these 5 topics. And when they have built a solid foundation, they can work with more impact and effectively on different health themes. We really stimulate schools to have a holistic view on these health themes, as these themes are linked and interconnected. Of course, a big part and an important part is the evaluation. So we really stimulate schools to evaluate, reflect, and to look forward, to really create this learning loop and to evolve in the health promotion.
Yes, and to help schools to put this healthy school approach into practice, we developed the online platform Your Healthy School. And Your Healthy School is developed from what we know from research. The key insights that schools are dynamic environments, that every school has a need for tailored information, and that the school feels ownership of the process they're in. And based on these insights, we developed the platform Your Healthy School together with the schools and our partners. And it's launched at the beginning of this year. And in the Your Healthy School platform, schools can find everything they need to work with the healthy school approach. It's divided in 2 different parts. First, learning and development. So schools can find a range of courses, e-learnings, and webinars. And the second part is the digital tool, Let's Get Started. And that's the tool that supports schools to work according to the healthy school approach. So they can find all the information about all the different themes. They can find actions and tips, and they only see the information that fits in their process and to their education type. So we really offer them inspiration for the next steps. Besides the Healthy School platform, we offer schools a lot more. On this slide, you can see the overview of all the services and products. For example, we have the Healthy School Advisors. Schools can earn a certificate, and we also offer them best practices, and we really encourage schools to implement these best practices.
Already 3,800 school locations in the Netherlands are using the healthy school approach, and this is 44% of all schools in the Netherlands. And in these circles, you can see how this is divided over the different educational types. By the end of 2028, we want to have more than half of all school locations in the Netherlands to work on the healthy school approach. And we want to end this presentation with a few enablers and challenges that we face as the Healthy School program. And I will just highlight a few as we are limited in time. A big enabler is that we have health in all policies in the Netherlands, as we are also financed by 4 different ministries. However, we are still dependent on national budgets. Furthermore, it's still hard to monitor the exact effectivity of the approach, because there are a lot of other variables that have impact on the results within the schools. However, the support we can give the schools with the online platform of Your Healthy School is a big enabler. And also, to end on a positive note, it really provides us to monitor how schools are working on the approach, and also gives us the ability to keep improving our program. Thank you.
Kirsten and Mirte for the really great presentation, and it's really interesting to see that close to half of schools across the Netherlands are implementing this healthy school program. And we see the importance of building a solid foundation and making sure that we have the community, all the community involved in making this a reality. So before we move on to our next session, I know that in this room, there are plenty of good examples around how healthy schools can be implemented in real life. So I just wanted to take a quick pause and maybe open the floor for anyone who wishes to comment or to reflect on what they are doing in their national context around healthy school environments. I see.
Is your microphone working?
Should be.
Okay, sorry.
Maybe I need to shout a bit louder.
Thank you very much. Congratulations to the organizers of this event. My name is Konstantinos Makris. I'm a professor of environmental health at the Cyprus International Institute for Environmental and Public Health. And thank you, Gabriela, for the invitation once again. And we are basically in Cyprus, we are leading an observatory that is based on the health promoting school concept, where we prospectively follow up the health, the environment, the lifestyle, the conditions that children face from primary school every year. So we have a network of 22 schools, and we prospectively evaluate the growth and development of the children with a very big team of complementary disciplines. And at the same time, we mobilize also the school community by having sessions for the teachers, by having sessions for the parents. We do pay a lot of emphasis on reporting back the individualized, personalized results of each child back to the family. And also have another layer of information that we give back to the school on specific issues that have to do with indoor air quality. I don't know how good the indoor air quality is here. The outdoor air quality, for example, the diet of the children, the sleep, the physical activity. We try to apply the exposome concept in holistically characterizing the everyday life of the children and how that shapes up with their own growth and development profiles. So we pay a lot of emphasis on trying to give back recommendations also, not only to the parents, depending on the personalized results, but also we give back results to the schools on, for example, the air that the children breathe, or the water that they drink, maybe the chemicals they come in contact with, also the canteen food, which is not always the best, at least in our country. So that's all. Thank you.
Thank you, Konstantinos. I think it was also good that you drew on the environmental aspect of health, and it's really nice that you have this example from Cyprus as well. So I think this might be a common theme throughout the conference, as we are running out of time for this session. But I want to give a big thanks to Kirsten, Merton, and Elke for their inspirational examples. And this brings me nicely to our next session, where we'll be focusing now, moving away from the policy and really seeing how in practice the health promoting school approach works. So our session is really focused on renewing this approach and seeing how at a European and national, regional, local level, how this approach can come to life in practice. So I would like to begin by introducing Schools4Health. We've heard about the project already mentioned over the course of the morning, but I wanted to give it a bit of a formal introduction, as through this initiative, which is funded under EU4Health over the past 3 years and also led by EuroHealthNet, this initiative really sought to put the health promoting school approach back on the map. From our own experience, we know that schools are not just places of learning, they are places of living. Yet schools are constantly being asked to teach health without having the conditions in place to support them in the first place. We've seen from various surveys that teachers are facing growing pressures. Health promotion is still treated as optional. I think we've reached a point that we no longer can continue operating like this. We need better ways of working together, particularly across the health and education sector. And this is why, for us, the health promoting school approach was such an inspirational framework to really guide our work. It really focuses on the key pillars to make a school a healthy school. It focuses on school policies, physical environment, social environment, links to communities, parents, access to essential health services. It really takes into account the key conditions to create healthy, happy schools. And in Schools4Health,
we sought to really use this framework as a guideline for how we operate as a partnership. And our activities really focused on the policy, the practice, and the engagement. And of course, EuroHealthNet could not have done this alone. We were strongly supported by 11 partner organizations coming from public health institutes, from academic institutes, as well as international organizations who worked closely with 16 schools around one common goal: to introduce or strengthen the health promoting school approach. In practice, this took place by schools implementing practices across health and nutrition, physical activity, and mental health. These themes were really the entry points to strengthen and introduce health promoting school approaches. Different countries chose different practices. We see in Spain, Slovenia, and Hungary, they chose to implement health and nutrition. In Romania, they focused on physical activity and mental health. And in Greece and Latvia, it was more focused on social competences. Different starting points, different practices, the same goal. We want healthier school environments for all. And this work also helped inform our policy. This policy work has focused very much on two key messages. Firstly, schools need to be supported by the right policy conditions, by the right resources, investments, so that they can truly become health promoting schools. And secondly, schools should not be treated as passive recipients of policy, but rather they should be engaged as active contributors to make sure that policies are designed in the way that should support them. So, looking ahead, our work is, of course, far from done. And this conference is really a chance for us together to work together closely, to connect educators, health professionals, policy experts around the same topic, moving from awareness to action. Our mission is the same. We want to create and make every school a health promoting school. We believe this is how we create resilient, equitable, and sustainable societies, one school, one community, one generation at a time. And with this, I am very happy to also hand over to my colleague Torsten Bollweg from the Technical University of Munich, who has been instrumental in evaluating what we have been doing in Schools for Health, and who will really walk us through the concrete outcomes and lessons learned from this initiative and by working together. Thank you for your attention.
Thank you so much for attending. This has been a great afternoon, very inspiring. My name is Torsten Bollweg from the Technical University of Munich, and together with my colleagues Denise Renniger and Professor Dr. Orkan Okan at the Technical University of Munich, we are responsible for the external evaluation, also collecting all of the insights and results. So over the last 3 years, Schools for Health has been able to work together with 16 schools across 6 European countries and serve well over 1,700 students. Also, we engaged with well over 100 teachers through training activities, workshops, and delivery of interventions. Worked together with regional and local governments, with NGOs, with parents' organizations to deliver interventions on promoting healthy eating, changing healthy eating habits, and also supplying healthy snacks within the school. Also, we addressed executive functions through a dedicated form of physical education in school. And lastly, also it was about mental health, emotional well-being, and being able to deal with thoughts and emotions in a positive way. And this was just the intervention level, and also on a broader level, Schools for Health has always been about advancing the health promoting schools approach. We did this through a number of activities, communicating to schools, stakeholders, professionals. We engaged with stakeholders and tried to figure out which health promoting schools policy initiatives need to be in place, which barriers there are. And also it was also about building capacity. So through training and consultation, this was also to address with a large group of stakeholders, not only professionals, also policymakers, and bring to them, or not educate them, but raise awareness about the health promoting school approach and health promoting school policies that there are in different countries. And also there was dedicated training on these interventions delivered to the implementing partners in the countries by the intervention developers. And also, we thought this before, we need to have some sort of central offer of information resources, and we've been able to come up with the Schools for Health Hub, which is providing resources and providing guidance also on how to implement the health promoting school approach for schools, but also for policymakers. And this is so that when this project ends in this month, there will be something that people will be able to use and find. And then again, also it was about initiating change, right? So it wasn't only about delivering the interventions, but we really wanted to motivate our implementing partners to think about how they can further the health promoting school movement in their countries, scaling up activities beyond the project's runtime. And when we are talking about the health promoting school approach, to us, we're often using the metaphor as planting a seed. And this could be an intervention, it could be a training session on the health promoting school approach. And what we found, or what we've been able to experience from our partners, is that when this seed comes together with commitment by all school actors, by training and funding with regards to staff, time, resources, money, materials, cooperation with external sectors, and also a school being part of health promoting school network, then it can become something bigger. It can grow, right? And on the other hand, what we also learned from the implementing partners, that this is not always the case, right? Because when health is not on the agenda, when it's not a priority in the school setting, when there's a lack of resources, overworked staff, too little time, lack of expertise, and lack of also political support, we will not see the expected outcome. And what we've been able to learn is that regarding to school staff, we've seen some changes that have been reported to us. For example, stronger understanding of the health promoting school approach. They know the concept, the pillars they need to address. And also these teachers that were hesitant at first in delivering these interventions grew more confident within the runtime of the project. Also, they were thankful for the practical tools and increased motivation, and also reported that through the Schools4Health initiative, health promotion activities were more integrated in the school life. With regards to pupils or students, we see an increased awareness and understanding and responsibility for their own health, especially with regards to the mental health interventions. We see improved emotional awareness and also greater confidence of discussing their own emotions in the classroom. And also, as a side effect, more active participation in class. I mean, this ties well together with what we found before. It's all connected. It's not just health, it's also educational outcomes and atmosphere in school, really. Then with regards to external stakeholders, which might be policymakers, municipalities, in the health and the education sector, we see stronger collaboration, reaching outwards of the schools. We see also interest in program motivation. So they're really hoping that this can be grown further, because right now I said 16 schools and there's obviously room for improvement there. And also increased backing for well-being and health promoting schools policies. So these were just some insights. There's going to be a report coming up in much more detail, and also in a panel in 1 minute. We're going to dive into that further. So this is just an appetizer. It's not all. And what we can learn is we can start small with an intervention, but we do need to start, right? It's about planting the seed, getting some expertise, some motivation in the schools. And what we also see is that bigger things can grow out of that, right? Then face realities, right? Schools are not waiting for us to tell them what to do, right? Schools are struggling, teachers are struggling, students are struggling. And unless we cannot solve or provide them with a solution to their problems, then why would they work with us and implement that? And thirdly, no progress without resources. We need time, money, funds, training allocated to that. Otherwise, we will be relying on individual schools, and we don't really want to do that. It's not the answer. So with that being said, thank you for your attention for now. And we're moving straight into the panel discussion with our implementing partners who have been at the forefront of this initiative. Without the implementing partners taking care of collaboration with the schools in the country, this would not have happened. And so I'd welcome to the stage Polonka Truden-Dobrin, public health specialist from Slovenia. Also Fanny Mesaros, a health promoter from the National Center for Public Health and Pharmacy from Hungary. Martina Kovari, Director of Nutrition Design and Research at the Prolepsis Institute NGO in Greece. Pablo Garcia Covillana de la Cruz, Director of Strategy for the Promotion of Healthy Living in Andalusia, from Andalusia, Spain. Petru Sandu, Senior Health Doctor at the National Institute of Public Health in Romania. And last but not least, Marta Emilia Sandore, Chief Specialist from the Welfare Department, City Council of Riga in Latvia. So thank you very much for being with us. It is my pleasure to have you here. And I guess we're all excited and learning more about you. And we structured this panel in a way that we are going to receive some it's interesting, you're really the stars of the show. Please do take the pictures. Afterwards, you can get your autographs, right? So what we like to learn really, we've went from the policy level to more broad insights. And that was so interesting because we keep talking about the same things for 30, 40 years. And I think we know the direction that we're going to take. But now it's really about what you have learned, the barriers that you have overcome, and what are the opportunities in your country. So maybe Polonka, please give us an overview of health promoting schools in your country. Tell us a little bit about the experiences that you face and also the opportunity that you're seeing. Thank you.
Well, perhaps I should start with the information that our 3 participating schools are really champions of the Slovenian Healthy School Network. Thank you. In fact, school from Ljubljana was one of the first schools in Slovenia from 1993, another school from 1998, and the third school from 2008. They were all involved in the Healthy Schools Network. So we had a very good foundation. But we shouldn't forget that every year a new generation is coming into the school and the new teachers are coming into the school. So this is a never-ending story, and we will not run out of duties and work that we have to do. So in general, our project in Slovenia focused on the upper secondary education schools. So the students are 15 to 19 years of age, because there is a smaller proportion of these schools in the healthy school networks in comparison to the elementary school. But in general, there is 75% of all primary schools that are in the network and 46% of secondary schools, the schools that we focused on. So our work was mainly to work with the students that are a bit let out of all the initiatives in public health area. So, and I believe we selected a very good intervention, the Belgium intervention Snack and Chill. We had great support from Stephanie and other people from the intervention, and the intervention was an add-on in our system of the school school meals that we have in Slovenia. What we like is that we involved students mainly from the vocational training programs, and they really, in a way, developed skills through this intervention, and the schools then used their skills, and they were quite motivated to participate in the local community, the school events. They provided so-called, we can say, catering through Snack and Chill, to present their work to other groups of students or to elderly or some other occasion. So in a way, this became a part of their professional development. And I think now we see that it was a good selection of the good practice. What we want to see now is that we can move forward and get this safety net from the European platform of healthy schools. We believe this is very important for us in the future.
So maybe I think, yeah, thank you. Maybe could you give us one example of maybe a barrier that you have overcome or something that didn't work? I'm thinking about your meat industry students.
Well, we had a group of students that work in meat production, that will work in meat production. So it was very important for them that we support their vocational training and their future profession. and they were really keen to participate. So we believe we had a good rapport with the students that when we visited the schools, and they were very open about their future work, and we were very pleased to see them. Actually, I must say that these 3 schools that participated are really very good schools, and the teachers are very supportive for the students, so that we could see.
Thank you so much for your experience from Slovenia. Let's go on to Fanny from Hungary. Please tell us about health promoting schools approach in your country, your experiences, what you have learned during the last 3 years.
Thank you. It's working, yeah. I will stick to my notes, otherwise I just get lost and it's gonna be like 20 minutes. So I would like to start with the current situation, the legal framework that we have. So since 2016, the school health promotion has been a mandatory component of the curriculum in all educational institutes in Hungary. The HPS approach is implemented by diverse group of professionals, including the teachers, obviously, health visitors and the school doctors, ensuring that the students receive accurate and reliable information from multiple perspectives. These activities can take place during regular teaching hours or organized during the afternoon session, so it can be it can give the school the flexibility to integrate those programs. Our institute also provides the toolbox for the schools that has an open source, so the schools can use it anytime they wish. This in Hungary, it's reinforced additional national regulations as well, such as the healthy nutrition program, the buffet program, and the requirement for daily physical education. I need to mention that it has a comprehensive approach, so it contains all the health factors such as nutrition, physical education, mental health, and health literacy as well. We have a new regulation now that came into force that external professionals can come to the schools now after the registration of their programs. So it's a new initiative, and I think it's very great because it can make the approach more colorful. But we have some challenges as well, as you might know. So the practical implementation needs to be strengthened for sure. So we have this legal framework, which is great, but we need to introduce best practices that are cost effective, easy to integrate into the curriculum, realistic, as you just mentioned before, and sustainable. When we want to avoid to put extra additional time for the students and for the teachers. We want to really just to build into the curriculum. So I would like to highlight 2 challenges that we faced and we think that we kind of solved during the program, the pilot. There is a significant variation in motivation and engagement. Each school has a unique social, environmental, and cultural environment, which is normal. That's how life works. So the uniform and these one-size-fits-all programs cannot be integrated effectively. So we just wanted to avoid those kind of forcing to put this rigid and so we just wanted to give the maximum flexibility to the schools as much as we can. So we decided to put the trust into the teachers because we just saw that they are professionally trained, they are very familiar with the daily realities of their school, they really are knowledgeable about the needs and the characteristics of their students. And our experience has showed that when we give this autonomy and support, they could implement any kind of health promotion programs flawlessly and sustainable. And we just needed to empower them a little and a bit of motivation. And another one is that you just mentioned the funding as well. So we don't have dedicated and predictable. That's very important. I think that's not predictable, unfortunately. So they just struggle to plan long-term long-term programs actually. So they just don't know what comes next, what's going to be the next year. What we found as a solution that they could involve like local producers. These actors can support the schools by special events or doing half days, sports days. And what we also realized that sometimes we just miss the parents. That's very important actors as well. So one of our school used the class funds as an investment. So actually the class could make a profit during the piloting program. So the students could learn about money management and investment as well. So it's very important because we just discussed that we need practical classes for them, and that could also work not only as a health promotion program. So I think, yeah, that was all I wanted to mention. Actually, these two key aspects, that we have this framework, which is a political framework, but it's great that we have, but we need to just put the not the pressure, but the trust on the schools. That's very important.
Thank you so much, Fanny, for this excellent statement. Also raising importance of the role of teachers and planability. It has to be feasible for them, right? Going on to Martina Kovari from Greece. Please tell us about your experience and what you've learned and the barriers that you have countered. Obviously, the learning happens when we're talking about the things that did not quite go as planned. So also hoping to learn from you.
Okay, thank you very much, Torsten. Hello to everyone. I'm very glad that I'm part of this last conference for the Schools for Health. Our experience from Greece, first of all, just to give you the context of the health promoting school approach in Greece. Unfortunately, as in many countries, this health promoting school approach was just an idea that the teachers knew, the schools knew, the families not at all, but we had some health promotion activities inside schools that happened outside of the typical ordinary teaching curriculum. So it was under the initiative of teachers to implement them, or in case some organizations that work on the field of health and education, to try to persuade schools to be part of this kind of projects and initiatives. This until the update of the National Action Plan on Public Health in Greece, which happened in 2020, and a little before, when the Institute of Child Health in Greece decided to translate this manual for health promoting school in Greek language, along with the planner tour for health promoting school. And then the schools had an access on an official manual of how they could do it, again in the form of guidance and in the context of another tools with which they were provided, related with nutrition, with physical activity, because this all happened under a program which was related with childhood obesity prevention. And the most important thing that happened to schools after this initiative was the September 2021, where we had a new educational context in the official teaching curriculum of the primary schools, which was called Skill Labs. This was officially integrated in the teaching curriculum. It is about 1 to 3 hours teaching hours per week, depending on the educational grade, where the teacher have access to an educational platform that has been created and officially assessed by the National Institute of Educational Policy in Greece. And they have access to different type of educational material of different thematic units in the field of health, physical health, emotional health, social health. So from this time point, we had new educational programs that were tested and uploaded in this platform, and the teacher was obliged to choose one of these projects in a specific thematic area and deliver it throughout the school year. The teachers were trained for this. They followed a 32-hour training workshop they took an accreditation for this training, and they were obliged at the end of the school year to prove that they have implemented and evaluated this practice inside school. Well, this helped us to integrate somehow our pilot in the context of Schools4Health project. We focused on emotional health, and we worked with the Dutch practice, what is called life skills. And in this case, we followed a similar structure. We trained the teachers with a training material of this best practice, and we asked them to deliver this best practice throughout the school year to the students of primary schools. Well, the problem and the first barrier that we faced was that schools, especially within the last years in Greece, are really understaffed. This means that the teachers struggle to make it with the existing teaching curriculum. So adding an extra thing to them was a very big barrier. So we decided that schools want outside of the school environment experts to visit them and support them on this health promotion activity. So we implemented it with experts like psychologists, health promotion specialists, nutritionists who delivered this intervention inside schools. The second barrier with this idea is the sustainability thing, because now we provided this service, let's say, in the context of a funded project, but the project will end, and now we need to think how this will be sustainable. So what the school suggested in the qualitative assessment and evaluation we did in the pilot is that we need more staff at school, but not more teachers, but school nurses, school psychologists, school nutritionists who could take the lead and work on health promotion inside school. So this is the main two challenges we need to address. Thank you.
Yeah, thank you so much. I mean, what we can learn from your input here is that curricula do have an input on what happens in school, and if it's not in the curriculum, it's hard to convince teachers to implement it. And also, yeah, understaffing is obviously an issue, because when we further overburden schools, it's not going to help the cause. So thank you for that statement. We're moving on to Pablo Garcia Covillana with your 4-minute statement on what's going on regarding health promotion school. Did I say 4 minutes? Can you make it 3? No, it's fine. Plus yours.
Thank you, Torsten. As you may know, the policy in Spain is highly decentralized. Although the beginning of the IPH approach in Spain back to the 90s, with some advance in some community autonomy. But I think there was an impulse moment in 2019 where the Ministry of Education and Health signed an agreement to promote the health promoting school approach over the whole territory. Yeah? In Andalusia, the region is where we are from, in the bottom of Spain. We began also in the 90s, but with a very traditional model of doing things in a school, yeah? Where external intervention and school were like mere recipients of this intervention. The real change we made in Andalusia was in 2015, where we agreed to work together between the regional Department of Health, Education, Agriculture, and Social Service. And we developed a new program based on the IPH model, yeah, where we integrate different healthy habits, giving the protagonists to the school, go into the curriculum. Also, in 2021, we developed like a new specific, model that was like, the Andalusia, well, the network of health promotion school of Andalusia. It's like we developed like a new grade of health promoting school approach. It's like the excellent for us. Okay, then we have like program, a basic program for many schools in Andalusia. Now we are more than 3,000 schools between primary and secondary school in this basic program. And also we have 250 schools who are already in the network of the health promoting school, yeah, for the excellent. This is like our situation of Andalusia. If we go through the experience, the key success, I think the main point will be, you know, the collaboration we have in Andalusia between the different regional, you know, departments. Yeah? You may know that Andalusia is a very big region with a network of health service. It's all public, and also a network of education service that we cover more than 1 million, you know, health and adolescent. Then it's quite a big system. Also, the commitment of the Ministry of Health and Education to make a new program that we did in 2015 with the principle of IPH model. This was the main thing. The first point I want to mention is like education took the leadership. Yeah? Now here we have representatives for 5 schools who participate in the Schools4Health program. But this is what happened in 2015. Education took the protagonist, and they create, you know, the Healthy Habit program became an innovative education program. For us, was the main thing. You know, it was not just health saying to education what to do. It's just education, include a new program, and we help, you know, people from the education. And the 4th point, I think very important for us also, is the support by the incorporation of 400 school nurses. After, you know, the COVID, they started to work in the school to help the COVID pandemic. But then when the COVID pandemic, they started to work with us in the IPS program. And then these have been like really good support for the school. Before that, we used to have, you know, doctor, primary doctor, school as a nurse, social worker who used to go to school. But now we have more than 400 nurses who are all the time in the school helping us. Yeah? Going into the barrier, we have some, you know. It's difficult for professionals from the school and from professionals from the health sector to take the IPH approach. It's a theoretical model, but it's not easy to put in practice sometimes. Also, sometimes it's difficult for health professionals to give the leadership to school. Yeah? And finally, I think one barrier we also have, we haven't been able to have, you know, an integral approach to support the emotional well-being of teachers. I think it's something we haven't done, and it's something that we need to do it. I know Torsten is looking at me. I just to say that this, as I said before, this is a theoretical model, but then what we found out with this project to put in practice, you know, snack and chill, we call Momentos de Fruta in Andalusia, really give a practical way for a school to really put in practice the model. Then we need practical things to make change in the school. And just one thing, I'm finished. We have money already between the Department of Health, Education and Agriculture in Andalusia to continue the project. Then next year, 2026, we will go 35 schools between primary scale. We will continue to implement snack and chill. That for us is Momentos de Fruta. Thank you.
Thank you so much. I mean, what we've heard all morning is that collaboration is key, right? And Pablo and Andalusia, they're just doing it, right? Ministry of Health, Ministry of Education, Agriculture also, and now they've got a great network from which we all can learn for sure. So thank you for sharing the experience. We're moving on very quickly to Petru Sandu from Romania.
Thank you, Torsten. Hi, everyone. It's good to see so many of you here. My name is Petru Sandu. I'm here with my colleague Alexandra, which I also want to acknowledge, because we did this project 2 persons and we did a lot of things. I don't want to brag, but it's the reality. The context in Romania is pretty interesting, but we learned about this very recently when we had our final project meeting in Bucharest on the 7th of November. that health promoting school was introduced in Romania more than 15 years ago at the end of the 1990s and the beginning of 2000 in 15 schools in Romania. But that's all we know, and we try to find out what happened, because on Schools for Health project, we started on unwalked ground. So we started from the beginning. Just to get to what we did in the project, we had 2 pilot schools in Cluj County in Romania, that's in Transylvania. And I would like also acknowledge the schools, maybe they are online. It's Liceul Teoretic Dumitru Tăuțan and the Liceul Teoretic Creștin Prodeo. They're really open to collaborate and to innovate. As we were telling them, this is innovation, this is something that you do, and it's going to change the way your school works. We had better movers and thinkers as a good practice in one of the schools, which is, as Torsten said, focused on development of cognitive and executive function skills in the physical education class. And that will probably make you better also in school. So not only be a better mover, but also a better thinker. And that's developed by Education Scotland. It's a really good practice, and it's part of the curriculum of excellence that Hof was talking about in the morning. And on the second school, we implemented life skills, which was implemented also in other settings that has to do with the development of social and emotional skills. And this was for secondary school students, and in the first school was for primary school students. Just a couple of phrases about, I would say, factors for success in these 2 schools, at least in Romania. One of them is that we had really good practices that were really, had a good, they were evidence informed, they were tested as being useful. They had a really good structure, manuals and so on. So this was really helpful in order to be able to replicate them in our setting. Another factor for success was the fact that the schools trusted us. They saw that we did not go there to implement a project, but to try to drive change. And now that the project ends, we told them that we want to continue working with them outside of the project boundaries, and we asked them what would be the possibilities. And one major limitation, I would not say barrier, but limitation or challenge, is that schools do not have capacity to innovate, because they are really burdened with paperwork, with all sorts of complaints from all parts of the society and so on. So we really need to help them do this innovation with our capacity to, write a grant proposal, look for good practices to implement in the school and so on. So we need to invest, the public health authorities need to invest resources in order to help schools do this innovation and make health promoting schools not just a project based, but something sustainable and something that will change the school context. And as a last idea, because we were given such like a structure to go through, for the future, we want to further promote this concept in more schools. We had a training in Bucharest, hold this training for 9 schools in the Bucharest area. So now there are 11 schools in Romania that heard about this concept and that they can use it. And we also have other plans of pilot testing, health promoting schools in 2 schools per county in Romania, and many other plans, but maybe we can discuss about this, during the day. Thank you.
Thank you for the experience from Romania. So what we're hearing is that it's very important to establish trust, to make schools want to work with you, and also see that you have a shared vision in helping schools, relieving some of the burden that they're facing. And we're at the last but not least panelist from Latvia. Marta, it is my pleasure to learn from your experience about the health promoting school approach in Latvia and the barriers that you have faced and overcome.
Thank you. I'm going to try to make this quick. Yeah, the history of the health promoting school movement started in Latvia in the early 90s. We already heard about the project today. In 90, it was a joint European initiative, and it started with 10 schools, and by 2007 there were already 150 schools that were health promoting schools in Latvia. But then the project ended, the movement slowed down, and in 2014 the Center of Disease Prevention and Control made their efforts to renew this movement, and now we have a national network of health promoting schools in Latvia, and the schools can freely participate, and we have already 129 schools
in all of Latvia that are the health promoting education institutes. Yeah, but in the capital city, Riga, we as a municipality try to give residents all the opportunities of health promoting activities and lessons. We have the municipality law and budget each year, especially for these health promoting lessons and activities, and we work with schools also. And last year in 2024 we managed to reach 2,923 classes of health promoting activities and lessons in schools. And yeah, basically I'm trying to say that the schools have opportunities, and it's their free will to choose what they want to participate in and what they choose to do. The key achievements in this project is that the students' understanding is improved, so much so that the relationships have been not so aggressive between each other, but they use more words, and they use also the school psychologists if needed. And a bigger achievement, I think, is that the teachers' knowledges and practices have been thank you, increased. Yes. And they use these knowledges and practices in their daily basis, and that is a really great thing to reach. And the challenges, of course, are that this is a project that ended, and we have to think of something sustainable. And for these practices, that we need funding and more collaboration between ministries and policymakers. But I think other challenge was that we also have understaffed schools, and teachers are overworked and they usually think of this health promoting practices as an extra work. So we need to, maybe the thing we have to do is invite teachers to help make these policies and these decisions together, so we can help their everyday life be more easier in inviting these health promoting practices. Yeah, but the good thing is that in Riga, every school knows that every year we have these health promoting classes and lessons, and they really look forward to those. They even call us every year and ask when there's going to be these classes and lessons. And yeah, so thank you.
Thank you so much. Oh, we've heard quite a bit from the panel, from the countries. Thank you so much for making it happen. I'd like to open the discussion to the audience also. What are your thoughts? What are your inputs, your ideas on what you have heard? Please.
Standing a bit for my back, but it was very interesting. I have a question to Martina. You talked about, and a few others talked about, health workers in schools, but I was wondering who is paying for that. Is it the school system? Is it the health system? Because we have that on mental health, and we see a lot of that it's not always easier to have different circuits for the same health worker. So sometimes it's a bit fragmentary. So how do you solve that part of?
Well, I don't know.
Thank you for the question. Yeah,
work? Okay, works. Well, thank you very much for the question. Well, in Greece, we have health workers that work inside school, primarily school nurses and school psychologists. But in this case, each school nurse, for example, is assigned to 10 to 20 schools, and so each school nurse may deviate 1 day per week in each school. This is the best scenario that we are having. This is, I mean, it is covered as a budget from like a school staff, so it is paid by the government. But the problem is that the school nurses are very few. The same for school psychologists. We're not talking about school nutritionists because this is not the case now in Greece. So the idea and what the teachers would like to have is school staff that is not related with the actual teaching curriculum and could support on all these health promotion activities, which is the specialty of other people. Because, for example, in our case, the pilot was related with social and emotional skills. This is something that a psychologist, for example, could do much better than a teacher who is trained for a couple of hours. So this could take the load from the teacher to the health worker. But this health worker needs to be assigned to a specific school to have the time to work on this.
Thank you so much. Indeed, it's very much about having the resources that can be activated by schools in need and not expect teachers to do that also, right? They're doing their subjects, they're doing conflict resolution, they're being gatekeepers to therapy, even when you're, depending on who you're asking. So it's really about getting the expertise that you need. Pablo, I know that you also have an interesting network setup of school nurses that can be activated. Do you want to elaborate on that?
Yes, because we have a really good network of primary care. Of course, we have problem in the health system, but I think we have a good network. Then all the school nurses belong to the Andalusia Health Service, but they spend their time, in the school. But we have a view of community, community work, community health. Then a school is part of the community. Is why we belong. And also there is other professionals, social worker, health promotion expert that all belong to the Andalusia Health Service.
Yeah, thank you. Any other questions, comments, ideas? Yes, please.
Hello, my name is Carla, and I'm from the American University of Beirut, from Lebanon, so far away from Europe. But it was quite interesting what I've been listening. And we actually do school nutrition programs all over Lebanon and the Middle East. And I oversee, and we have all the same problems in terms of to overwork teachers and mostly funding. So my question to all of you is that have you ever or would you consider collaboration for funding with private companies? How would you see this for sustainability?
Thank you for the question. Who wants to reply?
Hey, thank you for the question. Well, I'm coming from Prolepsis Institute, who is an NGO, and we are implementing many programs. We have a great expertise on nutritional programs, as you mentioned. So we're primarily working with funding resources from private sectors who want to fund that kind of initiative. So we're currently implementing nutrition programs funded by private and also public sector, but primarily private sector, to deliver healthy meals, for example, inside school, or to provide nutrition education. Even if these projects I'm having in my mind have a duration and time, I mean, we're running these programs since 2012, for example, it's not that sustainable because the funding from a private sector is not that sustainable. It changes. You need to reach less schools, less students. And in these cases, the public sector, the ministries, the government are not directly involved. They just provide their license to get inside school. But they have nothing to do with the whole approach, the whole activity, the whole intervention. You're the organization and the private sector who fund this initiative. So from my perspective, I think that private sector could support on this, on the funding resources, but you need the integration of government and ministries to make it work and make it sustainable.
Thank you. Are there any other ideas and comments from the panel on how to sustain the activities and how to acquire funds?
Sorry, yes, I think what we did in the model of Andalusia is quite sustainable because we're trying to use the resource or the public institution have. Yeah? And then it's the only way we found that we create a program, but we integrate in the system to be able to be sustainable for the future.
Yeah, I just wanted to add that in Hungary, if we talk about the canteen, for example, the school canteen, it comes with a procurement, so it's very, very strict. And as we have this legal framework that's very detailed, that has pros and cons, of course. And I think one of these cons that it's very really strict who can enter to the schools. So to have a contract with the private sector, a school cannot do that. So there's like the school district that can make a contract, and that's very difficult. So it's a lot of administration. That's what we are trying to do, that those NGOs that have great programs, our institute can register. So we look into the details, very, very into the details. So all the presentation. And if we agree that it's a good material and it's suitable for the kids, we let them in. But that's a new initiative that started now. I think it's great to make it, as I just mentioned, more colorful, but not sure if it's gonna stay as sustainable as we put into the curriculum. And yeah, you just mentioned that. Thank you.
Yeah, thank you. Polonza.
I just wanted to say that we in Slovenia are now in the process of getting a new strategy on nutrition and physical activity. And we believe within the new strategy, there will be some room to increase sustainability of the project results. But in general, we try to do things with public funding, and we try to get project funding for research and development work. This is very important, and I would just like to stress how good the program of today's conference is, because we got so many ideas what we need to be doing later on when we go back home. I would like to thank Elke, because it's just the same situation. It really, there were so many good points in your presentation. So we have to think about how to, synchronize between sectors and improve our cooperation.
Okay, it's not time for the active dancing break yet. Not just yet. So we've got time for one final remark. Come and add. Yeah, please.
Hello, everybody. My name is Viorel Babi. I'm from Moldova. I'm from an organization that supports a network of youth clinics in the country, and also a network of the health promoting schools. We have 79 schools, and one of the problems that we have in the network is about motivation, how the schools could remain and could stay in the network for a long period, and about the support that they can receive especially from the state institution. I mean, the recognition of their effort from the state institutions, the opportunities to share their successes in front of other partners, and also how they can have the opportunity to share the experience in between of the schools, and this also gives a lot of energy and motivation to go further. And I want to ask you how you are dealing with this motivation of the schools to stay and to perform. Thank you very much.
Thank you for the excellent question. So what is your magic solution to that problem?
Well, as I have the microphone, I would like to start. So I was very lucky because we found very, very motivated schools. So they are sitting here, also the students as well. So I think I just one of the luckiest person here in the room. And as I just mentioned, that if you give them it's not the key or something, but just to show that it's not require extra from the students and from the teachers, I think they have the motivation. That is what I say in Hungary. So I think that if you just show them that it's not like a huge thing, we don't want them to do like incredible extra work. I think they are motivated and it's there. They want to help the students. They want to do good things. That's what I see in Hungary, but correct me if I'm wrong.
Very quick statements from Polonza and Pedro, and then I'm going to try to wrap up the session.
It's just that we have a very good national and regional coordination with the regular professional meetings where the people can share the cases of good practice. And we also try to give them, the topics that are becoming more and more relevant through the years. Another thing is cooperation in the European projects. They also publish their cases of good practice. And they also participate in the development of strategies or some kind of regulation at the national level. So I think to have a good network, really good personal relationship helps. And teachers, they are very motivated and dedicated. So that's a good thing.
Thank you. Pedro.
Yes, very briefly, I would have a more maybe philosophic answer, because these two schools that we selected for the project, we knew them because they initially came to us asking us for having some lessons on different topics for their students. So if the school and the parents of the children identify that there are some health problems that need to be addressed, then it's easier to go to the school and propose something that is more systematic, that takes more resources, more effort, and so on. But if you are going to the school and they don't feel this need to change, then I think it's pretty hard, regardless of how many accreditation resources and everything else you give to them, if they don't feel that this is going to help them, and the parents feel that this is going to help their students and their children and so on. So the parents in our schools, asked us about the results of the test, cognitive tests we applied and so on. So if they are interested, it's easier to work with them rather than just being a unidirectional relationship.
Yeah. Thank you so much. I'm going to try to summarize this. It's not going to be easy. So the health promoting school approach is not new, but we've heard that it has been around a couple of decades, but it can go dormant in a country. We need structure, we need staff, we need expertise to keep it going. We need leadership for that. Health promoting schools approach need to be practical. It's a theoretical framework, but it needs to be put in to action. It needs to solve problems, must be easy to use. It needs to be adapted to local needs so that it serves the local population. Health promoting schools needs to have support and policies and curriculum and teacher training and funding. Also, trust has been highlighted as a key enabling factor on really making this movement work. Teachers are gatekeepers for delivering the interventions, and we need to support them. We need to empower them. Understaffing is an issue. Underfunding is an issue. And we need to work together with lots of not only sectors, but also profession within the schools. We need to engage with parents. And I would like to highlight the statement from the audience. We all have the same problems. Indeed, we do have the same problems across all of the countries. And it's great to hear about the solutions that we're having. With that being said, I would like to thank the panel of experts. Give it up for the panel, please.
So, hi everyone. I hope you had a nice break, a nice lunch break, and are ready for the second part of the conference. So before we move on to the panel with school representatives, we would like to launch 2 short mini documentaries that we've been working on in the past few months. And as many of you know, over the past 3 years, we've developed a lot of policy briefs, a lot of reports, a lot of infographics on how to strengthen the health promoting school approach. And these resources talk a lot about the what, the why, the how, but we also really wanted to highlight the who. So who are the people who work in education and health to make health promoting schools a reality? And so these 2 little documentaries that we created really aim to do this, to highlight the people who work hard on the ground to make health promoting schools a reality. And our aim with these documentaries was not just to showcase the health promoting school model as it is, but also really highlight the work on the ground. So the process, the challenges, the dedication, and also the story of behind the work. And so you will see in these two documentaries, I don't want to spoil too much, but we will hear the story of two girls, one physical health education teacher from Romania and one public health promotion expert from Andalusia in Spain. And before we show the films, I'd like to hand over to our Romanian partners first. So Petru Sandu and Alexandra Riemann from the National Public Health Institute of Romania to introduce the Romanian documentary and also introduce the protagonist of the documentary called Cristina. And also, I really want to thank both our Romanian and Spanish partners, as well as the schools that were involved in this for really making these documentaries possible. Thank you.
Yes. Thank you, Emi. There's not too much to say. I think the images will speak for themselves. Christina is a very dedicated teacher. She used to be a handball player. She's a handball coach. She's also a PE teacher. She couldn't be here with us, but I think this short documentary honors her work within the project, but also her work daily with the students. Because as I said, the project was for one semester and it finished, but she continues with the same passion every year as she did up until the project, and she will continue working with the students. So not very much to say, but to thank her for getting involved in the project. She really liked BMT, Better Movers and Thinkers, and you're gonna see a little bit about this. And we're gonna send her the long, I mean, we sent her 30 seconds, and now we're gonna send her the full mini documentary and the filming, and she's really proud to be broadcasted in Brussels, because she's a simple professor, PE teacher, which in Romania, unfortunately, PE teachers are not considered as important as mathematics teacher, unfortunately. So she's going to be really proud that her PE teaching work, is appreciated by so many important people. And once again, thanks to her for all her work in the project.
Am antrenat 25 de ani. La început era foarte ușor să lucrez cu copilul. Copilul dorea să se miște. Acum, pe măsură ce anii au trecut, copiii sunt tot mai sedentari. În prima zi a sesiunii de inițiere în BMT am văzut că se merge pe atingerea unor obiective dar seamănă cu educația fizică. Este un fel de psihomotricitate, BMT-ul ăsta. Au fost schimbări vizibile în ceea ce privește disciplina. Și asta e câștigul copilului, care până la urmă își va da seama că și mișcarea asta nu e așa numai alergăm și gata. Sunt mulți părinți care au spus că și-au dat seama că facem altceva decât ceilalți copii sau celelalte clase. O metodă cum e BMT-ul, care te face să gândești, care te face să fii ordonat, te poate ajuta și la starea de bine și indirect și la starea de sănătății mentale. Să-i lase să se miște, să-i lase să cadă, să-i lase să sară, să-i lase că nu pățesc nimica. Ăla este un copil sănătos.
I hope you enjoyed this first mini documentary. You already have a spoiler of what's coming next. I hope you enjoyed this first mini documentary about Romania. And next, I'd like to invite Pablo Garcia who is the director of the strategy for the promotion of healthy living in Andalusia, which you already had the chance to meet before, and who also happens to be the protagonist of the second mini documentary. So, Pablo, if you would like to give some short opening remarks.
Thank you, Emi. Thank you to RahelNet to allow us to present what we have gone through in Andalusia. I say a few words before, but the voice is not just only one person. I think the voice is for many, many people in Andalusia, professional. Here we are some of them, and then also the voice is from the people who are on the head. Yeah, for example, our last regional Ministry of Health to really help us to following and to move into the health promoting school approach. In this documentary, we'll see how we change the model, as we say, in 2015, and then the impact that the Momentos Disfruta program is the snack and chill, project that we implement in Andalusia, the impact that we have. Yeah? I hope you enjoy with it. Thank you. We used to bring help from outside to inside the school, but in the school we just speak about education, very separate. Health was outside and education was inside the school. The health sector, the education sector, also the social service sector, we're speaking in different language. And also the ownership, we don't want to share, our expertise. We don't want to share, our knowledge, our experience. And then for me, I think was a challenge at the beginning. The reason for really make a change was that I realized that when we used to go to the school to do things without a curriculum approach, without the involvement of teacher and other professional from the school, everything we did with a lot of effort didn't have any impact on children. The turning point for us when we were sit down together between health and education was that although we have an idea, we didn't have the model to do it. And then we found out, the model of the health promoting school approach that really adapt to our idea to starting a new way of doing things from an integral view of health, giving the protagonist to the school. My feeling when we started this new program was that, I could not believe it, that, after 2 or 3 years discussing with different people from the different sector, we managed to put together everything. For me, I think the best moment was when we really implement, the Momentos Disfruta program that we developed in Andalusia in the context of the Schools4Health European project. The first day I went to visit, I saw how, adolescents really go into the fruits, listening music, having good relation. For me, it was like a magic moment. The school decided that some students with some kind of difficulties, learning difficulties or social difficulties, become protagonists of this program, then, if we really change the situation of some students with this project, yeah. The reality really was more than our expectation. That really made me feel very happy. I feel proud to be part of this wonderful team of professionals that wanted to change things. At the moment, we have more than 3,000 schools between primary and secondary schools involved in the IPH program. And this school attend more than 1 million children and adolescents. For the future, I want that health is ready in school as a part of the educational curriculum.
I was blown away by those videos. I don't know if you were, but it was the first time that I saw the one from Andalusia. I already saw the one of Romania. So really great job. Thank you for delivering us such beautiful movies. So before we go further with other great participants that joined this project, we heard a lot today about collaboration, and I'm going to take that word also as a first word to start this session. Collaboration between different stakeholders is really essential to be successful and sustainable. And it was mentioned by all delegations that attended also yesterday's pre-conference as a topic that needs continuous attention. So I think the word collaboration is a word that you can take with you. We already gave the floor to health institutions, and now let's listen to the schools. May I ask the following persons to come here and sit down and to have a really good talk about your good practices. I'm really going to try to pronounce it well. Carmen de la Chica. Maria Dolores Jimenez. Roberta Scholmin. And Bojana Šaljić Podešva. So, welcome, ladies. It is now time to put the spotlight on you. I always say, from my experience, that teachers matters. Let's see it broader, because you're not all teachers, but school matters. That's why we invited you here to share your experiences in implementing health promotion practices in nutrition, physical activity, and mental health. With practical examples, they will clarify now how they have integrated these initiatives into everyday school life. What challenges did they face, and what were the factors that have supported their success? So to start this panel discussion, I want to ask to introduce yourself, and one by one also to highlight one or two of your responsibilities that help to make your school a health promoting school.
Okay. The first, thank you for inviting me. My name is Carmen de la Chica. I'm working in the secondary school center, public secondary school center. Is located in a small building His name is Brenes. He's a bill of the Sevilla in the south of Spain. And I'm working, I am teacher, coordinator about educational programs, coordinator about extracurricular activities of my center. What motivated my school to adopt the health promoting school approach was at the level of students. My school was motivated by the fact that we had the opportunity to address a problem we have been observing for some time, the presence of unhealthy eating habits at breakfast amongst our students. At the level of a school, we need to find a source from which to organize our extracurricular activities and give it in a single direction. Holistic health was our key. At my school, there is clear before and after in our educational approach to health. And the turning point was marked by the Enjoy Moments project in 2023. Before this, we focused on prevention, and our extracurricular activities were organized separately. With each educational project addressing a specific need within the school. When Enjoy Moments right at the school, we participate in all its phases for 2 years. We began to absorb its philosophy, its very essence, and started to integrate into both our curricular and extracurricular activities. Almost without releasing it, we reorganized the structure of our educational approach, especially the extracurricular one, towards a single focus, holistic health. Mental, physical, community, and environmental. Now, health is central to all decisions as administrators, and every step we take reflects the understanding that what we do must contribute to the health of the school community, both directly and indirectly, to the local area where our school is located. I'm talking about the projects that are chosen, those that are designed, the extracurricular and complementary activities that are planned, the social agents with partners, etc. We have integrated this initiative into school life thanks to 3 key elements. One, at the curricular level by creating an optional subject. The name of the subject is Health, Wellbeing, and Responsible Consumption. The last year, this subject was 15 students, and the new course have 45 students. At the curricular level, health is incorporated into the school's extracurricular and complementary activities and into the pedagogical work carried out through educational projects, in concrete 36 projects of the administration. At the structural level, an internal coordinator is assigned to the project, a person with a permanent position at the school, The main challenge my school faced in implementing this health promoting practice was integrating the project's development into the structure and operation of an educational center request, a team responsible for preparation, maintenance, and clean up, as well as preparing the project for numerous other tasks, coordinator meeting, documents, challenge, and preparation, etc. We tackled the challenge working in a team, working over time, making continuous changes to our schedule to accommodate the project timelines at tasks. It is a challenge whose solution it's not yet finalized. We need help from our administration. The key actions or recommendations that give to policymakers to create more favorable conditions for a school to become health promoting school are: one, sufficient time in plans, programs, and projects to be able to participate in all phases. Two, staff recognition in terms of working hours and salary for coordinator roles and participation in educational plans, programs, and projects. Three, visibility of coordinator teamwork as part of the task to be carried out within the development of a project. Four, creation of a figure of a health mentor, a professional cocktail between teacher and health agent. Five, for me, this point is more important. Pay more attention and invest more resources and concrete projects in the mental health of students in particular and the educational community in general. It's a part of health that is not being addressed fully and in depth, and it is having a strong and negative impact on our students, even leading to death and suicide in some cases. And the last recommendation is lower the classroom ratio to 15 students per teacher, creating a space for emotional and psychological well-being where pedagogy can be nurtured. Thank you so much.
Thank you, Carmen. I think the project in Spain was really, really big. You did a lot, and you told us now in a really short way what happened, and there happened a lot. So thank you for that. Please, Maria, can you tell us how it was during your project? Explain us what motivated you to improve health. Also, did you celebrate some successes, etc.? Please tell us your story.
Okay, hello. First of all, I would like to thank the authorities for giving us the opportunity to share our experience. For us, being here is an important recognition and a great motivation. My name is Marilo Jimenez. I am the principal of ESL Valle. It's a small public secondary school in the south of Spain, in Huelva, near the Doñana National Park. We have around 168 students. We are very small. Many of them from families with few resources. 35% are immigrants. Also, we have limited human and material resources. In this context, we are very conscious of the importance of health and well-being. These are the main motivation to join the health promoting schools network. What has changed a lot our school. One of the biggest impacts has been on educational inclusion. In our schools, inclusion is not an abstract idea. It's something that happens every day in the relationships between our students. Healthy routines, teamwork, and a positive atmosphere make all students feel part of the community, including, and it's very important, students with special needs and students who are new to the Spanish school system. A good example in how we have implemented the health promoting school is Momento Disfruta. In addition to the healthy nutrition, we could see how this project strengthens relationships, reduce social barriers, and makes inclusion in a natural part of everyday life, school everyday life. Especially, I repeat, for the students with special needs who have become closer to the reality of the workplace. It has been highly beneficial for them and for us too. Secondly, the health promoting school network on the environmental well-being and mental health of our students. Many of our students, it's a fact that many of our students arrive at the school with emotional difficulties. Being part of this network has encouraged us to integrate emotional education. However, we still need more external help, especially psychological support for students and teachers too. And at this point, teachers face many challenges: administrative work, students' emotional needs, and a lack of specialized mental health training. Although we have school nurses who are really very important in schools, in our schools, we need more external help because in many cases, these resources are not available in rural contexts like mine. Another important contribution has been to connect health, sustainability, and inclusion in all the subjects. We have learned that health promotion is not an extra task added to the curriculum. It's a fundamental part of the educational task. And it is even more important in rural contexts, where social and economical limitation increase vulnerability. In conclusion, being part of this network has changed a lot of our school. We have started to build an environment where students, teachers, families, and everything feel safe, valued, and a part of the community. Thank you so much.
Sorry, I forget a date so much important. The name of my center is Jacaranda.
Thank you. So thank you, Roberta. From the beginning of the project, I saw that you took a lot of responsibility. The situation in Hungary is not that easy to start with projects. We talked a lot about it, and I really look forward every time when I see you to hear more about the project in Hungary. So please tell us how you are able as a person, but also as a school community, to make every school, to make your school a health promoting school. What motivated you? And yeah, tell us, please.
Okay, thank you. I'm Roberta Spolmin from Hungary. I'm a physical education teacher. Our school is it's a pretty big school in Hungary. Yeah, our educational system is really strict, but fortunately my school and where I'm working, this is the supportive environment where every colleagues of mine are really innovative and they really like the new things. So this is why I'm so motivated, and this is easy for us to implement new things in our school life. So in our school, the health education forms a vital part of our pedagogical program, reflecting our commitment to developing well-rounded students who understand the importance of physical and mental well-being. And this is important to us because for example, I'm a physical education teacher, but I don't want only to teach the physical education, but also try to shape the students' attitudes to have a long-term health in a lifelong, I can say. We got to know this program in 2023, thanks to this project and thanks to Fanny, the Hungarian Health Education, Public Health Education Health Center. So because of the health education is an important thing in our school, we have a good event. This is the Health Education and Sports Day, but we started to feel that maybe it can't be enough for our students. So it was good to get to know this program, to expand our health education toolkit in our school. Yeah. So, and we are also really lucky because this is a supportive environment in our school, and the school leadership, the colleagues, the parents, and the students are really open-minded, what helped us much to implement successfully this project. Now I just try to introduce how is it in our school, how is Snack and Chill in our school, and what kind of next steps or future plans do we have. So our pilot event was in 2024 in April, and it was a great success because we tried to grab the students' attention, and we made a questionnaire, and their recommendation was really good and really motivating for us about future planning. So we try to manage to figure out our own system, and which seems to be working. We can organize second Snack and Chill events in our school two ways. On the one hand, when the Snack and Chill is a part of the Health Education and Sports Day. In these events, the students can voluntarily join to the serving team. And this is really nice that we don't force the students, but they come voluntarily and they really enjoy it. And the other way to organize these events is when we involve a whole class. So before starting the school year, we have consultation with the class teachers, and we always involve the students from the 10th grade. And there are two reasons why we choose this age group, because they are exposed to a lot of stimuli, and it is perhaps not too late to capture their attention about health education. And in addition, it is also true that these classes, since they are already spending their second year in our school, already form a ready-made community, so they can do it easy together, these things. But it is a good team building event also for the students. And I think that the key of our success is the involvement of the students. We spoke a lot about it yesterday, but it's really useful because they don't learn only about the health education, that's how you should live, but they have experiences through this simple but great project on the good practice. So we feel that there are many potential in this program, and we have new ideas how could we reach the whole school community and the whole students the community. So yes. Okay. Yeah, I just try to speak about our challenges. There was no challenges in our school by implementing this project, thanks to the toolkits, the every theoretical things that the HPS approach. We read a lot. We got a lot of help from you when we were in Brussels in 2024. It was a really good experience as how and we saw how could we do it well in our school. So it was a great experience, and the FANI and the Hungarian Public Health Center give us always motivation and help to do it well. Yeah. Yeah, and this project always provides the conditions for us to be successful. Maybe a challenge can the challenge can be that the money and the resources. So it was a big help for us that the project provided us the equipment, tools as knives, forks, or mixing bowls, and so simple things. What is really useful, and it was a great starter pack for us to do it successfully. Yeah. Yeah, and maybe I have a recommendation for a policymaker, just shortly, because I think that we have to focus more on the prevention and more on the students' health, because in Hungary there are not so good statistics about the students' health, and maybe the policymakers should give us more resources to sustain this project and to implement better in our schools. So thank you.
Thank you, Roberta. It was really a challenge to start every project, to start every good practice in their own context. Let's hear what Bojana has to say. Please present us who you are, what you do, and can you tell us more about specific actions that you took? But you also told me that you have experience with other projects, other good practices. I think both or all those good practices face challenges. So please tell us your story.
Thank you. My name is Bojana Šaljić-Podešva, and I'm a head deputy of Srednja High School in Ajdovščina, Slovenia. So to describe myself, maybe I can tell this, that maybe I can say that I have really good memories very good memory about the childhood and my youth, and I can well remember every kind person that I met and every supportive teacher that I met. So even if sometimes looks that it's a lot of effort for little outcome, in the long term I can tell you that it's not. It's really every job that we put in counts. So I'm grateful to be in this room full of such enthusiastic people, and to have the opportunity to share our experiences. And I'm proud to be the part of my school.
where I'm now for 8 years. So I'm no pioneer at all. There are other people. For example, we have a great principal who has both understanding of what the future desires and what steps we should make to go for it. And on the other hand, he is somehow financial genius, and he finds resourceful combinations. He also brings ideas to the ministries and so on, how to make something work. For example, we have now a great big new kitchen. I mean, we traditionally have been having this kitchen, but now it's really new and large. For the staff who works there is happy. The students are happy. We are the secondary school plus dormitory, and this kitchen provides warm meals for both, and there is also very good environment otherwise. So Slovenia is a country where traditionally health and nature and well-being have important impact on our society. So I can say, for example, that we have one warm meal that is subsidized by national institutions and local community. Anyway, we are happy to be the part of this Second Chill project, but it would be maybe even more impactful if we didn't have this basis. But even so, our students were happily entering this project, and as well the staff at the dormitory. The educator Alenka is with us today, and she was the carrier of the project Snack and Chill, so it was aimed mostly at the dormitory. And there were then extracurricular events for dormitory students where they were preparing snacks for their peers. 2 major events accompanied by some education about different emotional health and physical health awareness from the local health center. Then there was also a series of smaller events like baking the chestnuts in the small kitchen in the dormitory, which is also possible to be used by students. And there is one gap that we would like in the long term to fill, because we can see how nice it is for the students to prepare not only the cold food like cutting fruits, but they were also going to an event to the next primary school, and they have also this subject, like home economics. And because of that, they are equipped with large kitchens for students as well. And we would like to have that because our students really like to cook. And these smells and everything, it's really a good atmosphere, and it motivates them a lot to think healthier about the food. This is our future ambition, and I'm sure we are going to have it once because of our genius principal. I can tell you a bit about his work. He's thinking like this: let's not immediately buy the kitchen. Let's have the solar plant, power plant first on the roof, and then we can finance our kitchen. And if we do larger kitchen for some other institution, and we invite also that in our kitchen there eat some people from some companies, we can make some extra money to finance more projects. So when we are entering some projects, like we were also in this education for the sustainable future, and our principal thinks immediately what will we be able to keep, and how to be able to keep. So of course, we are here today also to promote some structural changes, which I'm totally advocating for. But in the meantime, we have to push, and we have to keep having good practices. Easier to ask then for funds if you already are doing something. So, for example, if we already do good practice every year, and then we say, look, we are doing this, but we are struggling, please help us, it's a better start. And I think this is very important. Then we are looking for the ways how to put something ourselves in the curriculum. So I will mention to you another practice, which is called Calcio Sociale. It came to us from Italy. I think it's as well a European cohesion project. And it's basically it's a football tournament, but accompanied with the creative workshops. And so we have teams that are from our school, from next primary school, and from the programs with disabilities, or even behavioral problems. There are some institutions around us, very various. So it's kind of very inclusive, also generationally. And then we make teams that are mixed up from everything and everybody. And so there is a football team ongoing, and not only the goal score, but also which team cheers the best, and who is the most sportive, and who is best engaged in these creative workshops that also take part meanwhile. Yes. So, and for example, we have 3 programs at the school, and one of them is for kindergarten teachers. So in the 4th grade, so they are last year, they have this optional subject. They can choose between arts or music or multimedia or sports. And we used that to provide for this football event, because those who are in sports, they are the football part. Those who are in multimedia, they make the whole propaganda about it and post it everywhere. So it's a big success. And we have then this art class, which prepares these workshops. So everyone is included. And so as workshop, we also brought once Snack and Chill, and it was really a success. Yes, I think, yeah, I would like also to mention this. All these projects are so important because they bring this social component, which is today so important. I read 2 days ago our network for health schools reports for the last years, and it's all the time about the emotional health. So we also see that in the school we need this support our teachers also carry a big burden. You need to know for so many pupils in the classes, what are their problems, how to react if someone falls in the hall or something. It's a big burden. And for this, we need more staff in the school. It's too much for the teachers. I would like to say this. What was my contribution? I started the practice that teachers, the head teachers of the classes, should do at least 10 pedagogical workshops with their classes through the year. Maybe it doesn't seem so much, but if every head teacher does so, it's really an impact. And I can say that we notice that the teachers who do that, who have this engagement to make this small society that their class is a healthy one, that the results are unbelievable. They reduced like for maybe 40% the absence of the students towards others who don't do that. And they didn't score any negatives at the end of the year. So you can say that it's coincidence, but I don't think so. Yeah, I think it's very important, this classroom work and this continuity with the head teacher, not just to do the administrative work. But this was possible because already several years ago, the head teachers voted that we all have one full hour, like 45 minutes per week classwork. Yes, so head teacher has ability to work with their classes. And I think it's very important platform that doesn't cost anything. There are a lot of small gaps yeah, this is the way I think we should do to look for this, how the school breathes, and find these interspaces where we can improve, not only but adding new funds, but by deciding that we change.
Thank you. While you were talking, I wrote down a conclusion, but you really closed this discussion already. Very, very good. So thank you for sharing all your experiences with us, but also with all those people online. As you can see, those teachers, students, health institutions, there are all really, really willingness to continue this project. And they mentioned, and I think we can take from their story how they need to adapt everything to their country, to their context. That is really important, and also seeing all those opportunities. And I think that's thanks. We are very thankful to you and grateful, and it's because of your motivation. So I want to thank you for this inspiring talk. And I just want to wrap up and just make a conclusion of some keywords that we heard. So I heard a lot of times extracurricular integration. So we need to move from an add-on to an add-in. I think that's really important. I heard a quote from someone who told, I think it was you, Maria, make all students feel part of the school community. So it's not only make every school a health promoting school, but make all students feel part of the school community. So we can add another sentence to it. But to do that and to keep our motivation, the most important are resources. We want to continue. We are motivated, but we need the resources, and not only financial resources, but also human resources. I think another word that was said was participation. we are here with a lot of people. I'm really thankful to the 2 students who are here, to the ones who traveled from far to come here, and to the teachers that brought the story from their school to this place. And I want to invite you now for a break. We have a new break, so because it's afternoon. I made some mood boards for every school. I will place them in the room there, so you can have a look and stay enjoying their story. So thank you. Yeah, we start again at 3:30.
Adopt a whole of school approach and integrate health promotion into school policies and development plans, and as Rolf was saying yesterday, to really integrate it into the DNA, integrate health promotion into the DNA of schools. We also recommend establishing a cross-disciplinary coordinating body. So this can be made up of school nurses, education coordinators, psychologists, teachers, both within schools, but also at subnational levels. And what really helps as well is to appoint a HPS coordinator. And this will once again help relieve the burden on teachers and also help with implementation. And finally, we should create and maintain a supportive and participatory school culture, because as we know, when staff feel well and feel supported and also have ownership, the health promoting school approach is much more sustainable over time. And this means involving teachers, involving the school community, students from the very beginning, so that the activities are relevant to them and also grounded into the realities of the schools. And this also means empowering them to become active contributors. Another thing that's important to underline is that health promoting schools not only contribute and advance health and education, but they also contribute to other agendas and can help address many of the cross-cutting themes that are highlighted in the slide. So for example, they can promote equity by directing more support to schools who need it and design interventions to reduce inequalities. They can strengthen sustainability by linking health and environmental actions. They can support digital well-being by creating spaces for safe and digital safe and healthy digital use. And they can boost social connection by creating belonging and participation, and also stronger ties with the families and the community. And lastly, some messages about and recommendations on how we can sustain and scale the health promoting school approach over time. First, we need to continue demonstrating impact. So this means strengthening the evidence base. This means evaluating interventions and really clearly showing the return on investment to both inform and also convince policymakers that this is an approach worth investing in on the long term. Second, we need to build capacity and awareness of the benefits of the HPS approach and how to implement it in a practical way. A key part of this, as I mentioned, is community participation, so really involving the school community and also the wider community in decision-making to increase ownership, buy-in, and therefore also sustain the health promoting school approach over time. And this will also help strengthen the social fabric around the schools. Closely linked to this is the importance of the community of practice, so creating spaces where schools can learn from each other, share challenges, exchange schools, and also build partnerships with local organizations, businesses, local authorities. And I think that's especially important in a time of resource constraints, to really align efforts and coordinate actions to create spillover effects and maximize impact in a way that schools could not do on their own. Third, this is also something we heard a lot today, to really ensure systemic teacher engagement by embedding health promotion activities into teacher accreditation, provide them with trainings, with professional development, and also a strong support system. And lastly, using legislation, the EU schemes, and partnerships to secure long-term support, because sustainable funding and multi-sectoral collaborations are really essential if we want to move from an isolated project on health promotion to a more system-wide change. And so to summarize, promoting health in schools is not just an individual project. It requires supportive systems around the schools, clear frameworks, adequate resources, meaningful participation, and strong collaboration between sectors. And hopefully with these right policies in place, we can then create an environment where schools have the opportunity to become a health promoting schools and where children can thrive and be healthy. And so if you'd like to explore any of these policy recommendations more in depth, they're available in our 5 policy briefs. We also produce 2 infographics and 2 very interesting and rich reports that you can all find on our Schools for Health hub, and you can also follow us on LinkedIn. And so speaking of what I was saying around community of practice and engagement, I'd like to hand over to Carol and Stephanie, who will now present the tools that we created to engage and support both policymakers and practitioners. Thank you.
Speaking of collaboration, Stephanie, you wanted to be on this side, right? Do you want to move now?
No, it's okay.
Okay. I'm Carol from ISCA, and I know it's been a long day for all of you, and I have a small game for you all, because I think we have learned a lot, but we all stay seated. So anytime you hear me during the presentation saying HPS, for all of you who can, please just stand up for a second and you can sit afterwards. We will see how it goes. So in this session, Stephanie and I were going to tell you a bit more about 2 online training tools that were created. And I don't know if this looks familiar, but it's a good illustration of how I felt this morning after the first sessions. Wow, so many information, so many tools. Where do we go? Would you raise your hand if at any point in your life it sounds familiar, this feeling of I don't know where to start. I love healthy promoting schools, but I would like to start an initiative. I don't know where to start. It can be before today, okay? I'm not saying it's an assumption here. Okay, so right now we are going to tell you actually not too much about the tool, but rather about the story behind it. And I would like to introduce you our fictional characters. Ariel, a teacher and care coordinator in a school. Matt, who is a principal at Ariel's school. And Abdinar and Clara were a policymaker in their region. It could have been all of you who were sitting and sharing the stories, but we wanted to say something about the ripple effect of these 2 tools that we're going to introduce and how it can create a movement. Stephanie, would you like to walk us through the first chapter?
I will. It's not a bedtime story, so I hope you all stay awake and don't tell it to your children when they go to sleep, because it's not a child story. So I will begin. The discovery. Yesterday, between 2 lessons, Ariale, a teacher and care coordinator, scrolls through her educational platform. She stumbles upon an article about health promoting school, an approach that transforms schools into places where health, well-being, and learning go hand in hand. Her eyes land on 2 tools, one for school practitioners and one for policymakers. The practitioner tool offers a clear roadmap with 5 steps to turn every school into a health promoting school. Ariale immediately sees the possibilities, from healthy snacks, better moving activities to lively life skills exercises in and beyond the classroom. But she knows, without principal support, it will remain a dream. is nervous, but she has to do the talk. Armed with courage and enthusiasm, Ariali knocks on Principal Matt's door. Matt, I found something that could really make a difference, she begins. She explains how the tools guide schools step by step from idea to practice, including planning, communication, and evaluation. She emphasizes that research shows that health promotion leads to better academic performance, less absenteeism, and positive school climate. Matt looks skeptical. Ariali, we get new tools or methods thrown at us every month. Why would this one be any different? Ariali recognizes his hesitation, and because this isn't just another tool, Matt, it's an evidence-based approach backed by the World Health Organization and successful in hundreds of schools worldwide. Matt leans back. And what do you need from me? Just a chance. Let me start a working group with teachers, parents, students, and stakeholders from our community. We can begin small, a pilot with healthier snack options and movement breaks. And I want to bring this up at the next staff meeting. So let's go to the bridge. Ariali takes a deep breath. There's also a tool for policymakers, Matt. It shows how local, national, and international governments can support health promoting school with resources, training, and legislation. If you put this on the agenda, we can create structural change, not just for our school, but for all schools in the region. Matt frowns. You're asking me not only to invest internally, but also to lobby for policy changes? Yes, because if we take the first step as a school, but policy doesn't follow, our efforts will not sustain. Advocate for support and funding will strengthen the movement of making every school a health promoting school. And we can be the pioneer of our community. The small and big efforts now will have long-term effects, healthier children, better academic results, and less pressure on the healthcare system. Please, what is the decision of Matt?
Matt stares at the wall. He is very doubting. And he just looked at the poster display of his school's motto that says, growing together, shining together. And he finally decided to give it a try. Okay, start your working group, Ariali. I will give you 3 months to come up with a plan, and I will bring it to the next policy meeting. But you better give me convincing materials for this policy tool. Ariali smiled. You won't regret it, Matt. This isn't just another tool. It's investment for the future. And now, fast forward a year later, the HPS effect. Matt School and Ariali School are now known as one of the first HPS schools in their region. Students are eating more fruit and vegetables, teachers are less stressed, and academic scores have arisen. There is even at the CTO and at the region a working group working on rollout HPS to other schools. And Ariali and Matt tonight, they're sharing their stories to stakeholders like Abdinor and Clara, the policymakers, and they're sharing their stories because they want more people to be on board. And one thing will stuck in Clara and Abdinor's mind. It's Ariali that says, it started with a tool, but it sparked a movement. And it's because health is not just another subject. It's the foundation on which people and our children are learning, dreaming, and growing. We believe this story could be yours. And actually, we have heard today, it's some of yours already. But we also know, and we have been through the project seeing and identifying some of the pain points. I will not read them out loud. It's actually echoing a lot of things that were shared today. But again, if anything seems familiar to you, or if you have heard it when you wanted to convince someone to try an HPS initiative, please stand up. And you can take a moment just to look around you, because you can see you are not alone. And that's exactly the reason why, through the project, there has been also the legacy tools that we're going to introduce.
Yeah. Today, you will get your answers. And I know we started with the cartoon, not a new tool. Again, yes, we have 2 new tools, but it's realistic and they are real solutions. I think you can, if you look back to the slide that Carol presented, you could have seen the words why, what, who, how. I think that are the most important steps to go step by step and do the process step by step. I tried, I struggled to translate the SHE school manual into a really practitioner's tool and to make it easy, to make it digital. And I waited until that little light went on, and that is the result. So I just take you a little bit into the tool, but not that much. It's a training tool for practitioners, and it starts with the first step, so getting started. And when we are getting started, it's needed to have a common language. So I want you to keep in your mind the word participation. Give it a definition. What do you think it means, participation? And if you go home, or if you walk down, take the elevator, ask someone who also joined this day to share his definition. Will it be the same? I don't think so. There will be differences. So we need a common language to go together, to collaborate step by step. And I want you to stand up again when you're not alone here. So when you have a big delegation with you, please stand up if you're not alone at this conference. And I can say from my institution, I have a lot of support. And I can say Slovenia has also a big delegation. Spain, there are with many people here. But we are not alone. Even if you are alone here, I think we have many supporters online and supporters in our institution, in our community. So you're never alone. The next step is assessing your starting point. Do you know already your priorities? Do you know the priorities of your school, of your students? Just think about that before you start. That's your starting point. So in the tool, it is included how to measure your starting point by using a tool that was already developed when the Schools for the School SHE manual was developed. The next step, the third step, is the action plan. You have to plan before you start. And I think you can already plan. We planned also yesterday with the mood boards. We learned from each other. And today, I think many of you have a head like this. I do. And they are thinking what next steps they will take. So please plan your actions and take all the good practices and all the obstacles that you heard here with you. Then we go to the taking action point. Here you can see your checkpoint. Check everything before you go further. And then we have the last one, monitor and evaluate. Please don't forget, because it's so important. I won't read it out loud because it says what it says, and we have mentioned it a lot of times today, so you will receive the PowerPoint and you can just go.
And the second tool we developed, speaking of common language, is a guide for policymaker. It's now live and updated. And there is 3 main messages there that what's needed is actually for policymaker to set the vision, the framework, and the resources and support. That's my translation of what's written there. And speaking of common language, again, a lot of the tools that are introduced in this guide are the ones that were presented by Amy. So I'm not going in depth into it, but they really answer some critical challenges. Some of them were mentioned earlier today as part of WHO, UNICEF, and who else was there? UNESCO and even the European Commission. So these are 5 pathways to impact. That's what you will find in there. And more than those policy, sorry, I'm losing my words. There is also in-depth recommendation by the expert we were involved in developing the tools. So it goes even a bit further into what you can do when you're using those ones. And again, I think the core message here is just that those two tools together, they're hopefully answering the challenge of materiality and providing a common language together. So that's the idea of the two of them. And why it's needed, it's because there is the power of integration. Policy without practice and practice without policy will go nowhere in any kind of sector, and especially in health promoting school. And this is just an illustration of what can happen when the two work in tandem. There is a feedback loop whenever the two are working together. And it's about the funding framework, the legislative support, and the implementation evidence. As Stephanie mentioned, we are going to share those slides, so hopefully you can also use them in your advocacy with your own team. We're running a bit out of time, but Stephanie, I'm giving you the floor.
So what if those tools could help you to go from one-off actions, because many times we start with one action, but we want to continue in a systematic, structured, and sustainable way. So we have some recommended next steps. Maybe it's possible to take a look at our tools and share your experience with the hashtag Schools4Health. That would be very nice. Then we can see what did you take home? What did you do with it? Talk to your colleagues about it and join our community.
It's the only moment where Aziska would order you to take the elevator. I really needed to step on it because we have a campaign and no elevator there. You said people can take it, and I agree, but only if you're bringing people on board with you on the HPS.
So you can put the next slide. So I want to thank you, and I hope you will join our journey. We already started. We started the idea with a train to take you with us on the train. So I hope you will join our journey and have a look at Ariali and Matt, how the tool is in practice, and also the policymaker tool. So thank you for your attention, and I hope this presentation was light enough to end the day.
Thanks a lot, Carol and Stephanie, for your super inspiring presentation and for the toolkits. And I hope it's all very useful for all of you here and online. I won't take long, but I would like to conclude this inspiring day with some reflections from my side. I was really impressed with all of the presentations from everyone, from the schools in particular, but also I was impressed to see how the big institutions, the European Commission, UNICEF, UNESCO, WHO are all committed to improve health and well-being in the school environment and very much aware of what we can do. So I do feel that there is a bit of a commitment out there that we need to capitalize on together. I think someone already said one thing that emerges collaboration. So we need to collaborate even more together, collaborate with everyone out there that are working with the schools, and ask for stronger policies and see how we can scale up the health promoting school approach and make it sustainable. I think sustainability is an important word here. Some things that, I mean, I can't say, of course, everything that has been said, and Emmy already did a great job by presenting the policy recommendations of the Schools for Health project, but just a few things that resonated with me very much, that I like that the health promoting schools is so much inclusive. It brings on board everyone from the children themselves, the young people, teachers, the well-being of teachers, how important that is, and also the communities and families. And I liked what the speaker from UNESCO said, is that we need to work with the education sector planners. That was at least sort of new to me, to institutionalize health and well-being into the curricula and so on. So I think that is maybe a very important stakeholder group that we need to engage with more. Then a lot of you and us, we said, well, we need more resources, not only human resources, but also financial resources. And I think that the health promoting school model should include ideas for investments. How can we pool budgets across sectors? What mechanisms are out there? What investors are out there that can support our work? Someone mentioned the private sector. Maybe we need to work on criteria like ethics criteria to know, okay, with which private sectors we can go on board and others perhaps not. We should be aware of pitfalls of working with private sector. So I think this element on investment may be a good recommendation to take further in the future. Then also, I noted throughout today the importance of national frameworks, or European frameworks, national frameworks, but also to have national health promoting schools, so national networks. And I really hope that we can revitalize these national networks on health promoting schools in all of the European Union countries. And there are frameworks for that. I mean, we heard from the WHO, the Child and Adolescent Health Strategy. We heard from the Commission, the Pathways to Success. What is it, framework, and the education area work. Also DG Santé was here this morning. I spoke with a representative from DG Santé, a bit quiet in the back, but they were there. So there are frameworks that we should use for our policy and advocacy, but also to have to strengthen the networks in the countries. I think what was very useful, I would like to repeat again here, what Sophie Julien said about her invitation for a webinar or a meeting, an online meeting on the 26th of February next year, where the national focal points will discuss revitalizing the WHO-associated health promoting school network. And I think that is a very important direction that we can take to make sure that health promoting schools is on top of member states' agendas. In a way, I think this conference leads to a renewed political call, or a new call for political commitment, I should say, for health promoting schools. And I do feel there is appetite in policymakers across the political spectrum to invest in health and in schools. So there is momentum, and we should use that. Add to EuroHealthNet, yeah, we are very sad that it's the end of the Schools for Health project, but it is not the end of this work. So we have set up a thematic working group within the EuroHealthNet partnership, which is led by Gezond Leven Flanders, together with the Danish Health Education Committee and Spain, the Ministry of Health, and we are inclusive, so we would like to use this group as a group for EuroHealthNet and as a sounding board in a way for the more the grounded WHO-associated network for health promoting schools. And we work with others like the SHE network and the SHE coordinators, which we hope to absorb in the new initiatives. And we work with the UNESCO chair in education and with UNESCO and UNICEF. I mean, I think we need the inclusive way, and cooperating with everyone is really the way forward in this area. Right, I would like to thank everyone for being here. I would like to thank our online participants to sticking with us for the whole day, and for all of your comments and suggestions. I would clearly want to thank all of the speakers for their inspiring contributions to our collective goals. And last but not least, I would like to thank the team that organized this conference, which is a team from Gezond Leven, and also very much the EuroHealthNet team, Gabriella Sutton, of course, together with Emmy and Ingrid and David and Chris behind the computers. So thanks a lot. And tomorrow we have another day for some discussions. And now we have also a reception. So I would like to invite you to that as well. Thank you.